We have a couple missing members. And I will introduce who they are. They won't be here with us today, but they will be here in the next 2 years with us. I also want to welcome people who are a member of the audience that are here. I appreciate the input that you'll give to us today. I want to welcome the people that are coming in via Zoom. And although we won't be able to hear their testimony via Zoom, I just want to remind people that we will take written testimony or written comments at any given time on our, can be sent to our email, and all of those will be reviewed and commented by members of the council. So I just want to say welcome to everybody. So we're going to start with the swearing in of the Maine Recovery Council. Before I start, I will share with you that Gordon Smith is coming in via Zoom, so you can't see him, but he is here with us today. Chastity Toole is late, and she'll be sworn in when she gets here. Melissa Hackett is a new member of the council. Unfortunately, could not be here with us today, and she'll be sworn in another time, but will be at the January meeting. Bruce Nunn gives his deep apologies, but he's had a family emergency, so Bruce will not be with us here today. He's with his family, and everybody else is here, who they will introduce themselves in time. But I think what we're going to do first is be sworn in. Not yet. And I do have to clarify, I am only here in the capacity as a facilitator right now. I'm not the chair. These are all the ones that have signed your paper. So if you all could please stand for me.
All rise.
Yes, Judge.
You gotta say it.
Say it deep. And repeat after me. I. State your name.
Awesome.
Do swear.
Do swear.
Constitution of the United States.
That I will support the Constitution of the United States.
State.
And of the state.
So long as I shall continue a citizen thereof.
So long as I shall continue a citizen thereof.
I'll be God.
So help me God.
I. State your name.
I.
Do swear.
Do swear.
That I will faithfully discharge.
That I will faithfully discharge.
To the best of my abilities.
To the best of my abilities.
The duties incumbent on me.
The duties incumbent on me.
As a member of the Maine Recovery Council.
As a member of the Maine Recovery Council.
According to the Constitution.
According to the Constitution.
And laws of the state.
And laws of the state. So help me God.
Thank you very much.
Thank you so much.
Thank you. Right, so I think the first order of where we are right now is for us to introduce ourselves to those coming in via Zoom. And for those who are present, and I'll start at the end of the table here. You just briefly introduce yourself.
Sure. My name is Liz Blackwell Moore. My pronouns are she, her, and I'm the Director of Public Health for Cumberland County Public Health. And I've been a member of the council for the last 2 years. I represent the cities and towns that are subdivisions of the opioid settlement. Yeah.
Thank you.
Thanks.
Morning, I'm Maggie McLaughlin. I'm the Director of Health and Human Services for Portland. I am a new member on this council, excited to be here and contribute to the work.
Thank you.
I'm Paul Vinsel. I'm an addiction medicine physician working with Spurwink, as well as the family medicine residency at Central Maine Medical Center.
Good morning. Thanks for joining this morning. I'm Benjamin Mann. I'm the Deputy Commissioner of Finance at the Department of Health and Human Services here in Maine. I'm an appointee of the council by the governor. I previously served as the treasurer of the Maine Recovery Council as well.
Good morning. My name is Holly Stover. I am a fourth-term legislator. I represent House District 48, including the towns of Boothbay Harbor, South Port Edgecombe, West Port Island, and South Bristol. I also am the director of a small nonprofit in Boothbay Harbor, the Community Resource Council. We run 8 programs for the most vulnerable in our communities, and I split my time between that and running an addiction outreach program with the Boothbay Harbor Police Department. I've been doing that for 8.5 years. Thank you.
My name is Amber Pulsifer. I work at the Comprehensive Treatment Center in Presque Isle. And this is, I've just been sworn in. Thank you. Welcome.
Good morning, everyone. My name is Todd Brackett. I'm the sheriff in Lincoln County. I'm also a representative of the participating subdivisions. And this is my second term.
Good morning. I'm Betsy Fitzgerald. I also represent the litigating subdivisions, and this is my second term.
Thank you. My name is Pat Kimball. This is my second term. I am an affected family other member, a recovery advocate, and I am retired after 30+ years of working in the field of substance use disorders and mental health. Thank you. Welcome.
Good morning, everyone. I'm Tess Parks. I am the policy director for Maine Recovery Action Project. A person with lived experience finding recovery from substance use disorder, and this is my first term.
Good morning. My name is Joe Everett. I just look at everyone. I'm the president and CEO of the Opportunity Alliance located in South Portland. This is my second term. I've been here for a couple of years, appointed first by Speaker Ryan Fecto, who's now the speaker again, and then by Speaker Talbot Ross.
Thank you. And Gordon, you can't see Gordon, but he's on the screen down here. Gordon, do you want to introduce yourself?
Sure. I'm Gordon Smith, the state's director of opioid response in Governor Mills' office. I'm one of the governor's 2 appointments, along with my partner, Ben Mann. Thank you.
Thank you. Gordon, you sound like you're the voice. You're the big voice up above.
Good to know. Good to know.
Important people that are here that I'd like for them to introduce themselves is, one is Mary.
My name is Brendan O'Neill. I'm working in the Attorney General's office.
And up back. It's Grayson. Thank you. And Katrina. Thank you all. That's our team. Small but mighty. All right. Thank you very much. So the first order of business is one of these weird things with the way the bylaws work. We are going to elect new offices, but we do that at the annual meeting. In the interim, we need to have officers in place so that we can get invoices signed and meetings done and some other work done. So I'm asking if the council is willing, and I've spoken with all the willing parties, if you are willing to vote in the former positions in offices that were there for the last 2 terms for a temporary stay until the annual meeting in January, where we will vote on permanent officers for the next year. And those individuals would be vice chair would be Bruce Nodden, treasurer would be Ben Mann, secretary is Betsy Fitzgerald, at large would be Gordon Smith, and Pat Kimball is chair. And I'm just asking that you, at this point, looking for a motion from Betsy has it to, if you're willing, to elect temporary offices until the annual meeting in January.
I move with the purpose of ensuring that the council can continue to conduct its business until its officers are elected at the annual meeting, in accordance with section 5.3 of the bylaws, which authorizes the election of officers to fill vacancies within the council, to elect the following members to serve as interim officers of the council: Pat Kimball as chair, Bruce Nodden as vice chair, Betsy Fitzgerald as secretary, Ben Mann as treasurer, and Gordon Smith as the member of the executive committee. These interim positions will expire on the date of the annual meeting.
I'll make that movement.
Okay, Paul will make a motion. Do I hear a second?
I'll second.
And it's seconded by Holly. Do we hear any further discussion on that vote? So for those who don't know, this committee does a roll call. That's by rule. So we will call each name and you will give your vote either yay or nay. Also, if you come via Zoom, we have to see you visually so we can see Gordon. So I'm going to ask Grayson, do you want to call a roll, please, for us?
Okay.
Ben Mann.
Yes.
Betsy Fitzgerald.
Yes.
Chastity Toole. Gordon Smith.
Yeah.
Holly Stover.
Yes.
Joe Everett.
Yes.
Liz Blackwell-Moore.
Yes.
Maggie Laughlin,
Yes.
Lisa Hackett, Pat Kimball,
Yes.
Paul Vincent,
Yes.
Tess Parks,
Yes.
Barbara. Yes.
All right, thank you all. Motion carries. Thank you all. So on a second note of business before we move forward is that in our bylaws, in order to place names in nomination for executive committee positions, we have to have a 30-day period where you receive those names. We're asking at this point, for the sake of time, that we have a motion that reads, what does our motion say? That we move only for the 2025 annual meeting to shorten the 30-day time frame in section 6.4 of the bylaws, and instead to require the governance committee to submit the slate of officers and nominees to the council as soon as practicable after its meeting and no later than a day prior to the annual meeting. So we're asking just for this 1 year to not have the 30 days that you received that notice.
So moved.
It's been moved. Do I hear a second?
Second.
Any discussion on that vote?
When is the governance council?
As soon as we discuss who would like to serve on the governance commission,
Same thing.
then we will have a little quick as to do, and it'll be a Zoom meeting. It won't be an in-person meeting. And again, it's the holiday, so we have to juggle a little, but as soon as it's my next business is there people who'd like to serve on governance? And then we will get together with them and find a date that's works for them. Good question. Any other discussion? If not, Grayson, can you call a roll? Yes.
Ben Mann,
Yes.
Betsy Fitzgerald,
Yes.
Gordon Smith,
Yeah.
Holly Stover,
Yes.
Joe Everett,
Yes.
Liz Blackwell Moore,
Yes.
Maggie McLaughlin,
Yes.
Pat Kimball,
Yes.
Paul Vincent,
Yes.
Tess Parks,
Yes.
Todd Brackett. Yes.
All right, so one quick thing of business. Anyone who would like to serve on the governance committee, please either share that with me now or after the meeting. And I will appoint you for the governance. Betsy said she will do it.
How I would like.
Oh, Joe will do it. Joe, Betsy, and anyone else?
I'd like to do it.
Oh, excellent, Tess. And
I,
anyone else?
I'm happy to continue on the committee, Pat.
And Gordon, all right. I will email all of you and let you know. And we'll get a date together. And as I said, it will be a Zoom meeting, so people won't have to travel. So I appreciate that. All right. Thank you for all that. I think that is the business end. And I'm asking at this point for Mary Coyne, our coordinator, to come up and share with us all a quick overview of the past 2 years. It's certainly, as anyone who served on the council for 2 years, it's certainly been a whole lot of work and a huge learning lesson for a lot of us. We did some things really well, and we did some things that need improvement. And so we will get there, but Mary has graciously put together a presentation to share with us the work that we have over the past 2 years. Thanks, Mary. It's like a theater. Without the popcorn.
You guys want to go down there and sit down there so you can see it? You Go down there and sit so you can see it.
That screen's big enough you can see from it.
I just thought I. What I mentioned.
We loved it.
We lived it, we sure did. The good, the bad, and the ugly. Is your mic on, Mary?
Yes, and this one.
Okay.
Don't want you right in there. I told you. That's it. This is where I say, remember the day of the newsprint? And you just flip the page. That's right. It goes like that. You flip the page and a magic marker. Yep. Did we get it? No, I see something here, down here. I see it, your first page, but I don't see it. Oh, it isn't. Well, you little techie. Ben says the projector's not on. All right. Go without it. You can use it for your own benefit, but.
Okay, I'll just talk about process. We'll do it that way. Hey, Mary, do you want to come sit here and see, or what do you, what would you? I'm happy to run for you. That's better. So I can, okay, face this way, yeah. I will briefly walk you through our appearance of the night, and you can imagine individuals, that. So as many of you are aware, Maine Recovery Council, is receiving 50% of the opioid settlement funds. The Attorney General's office is also receiving funds and our subdivisions. Our 50% share, is going to give us about 115 million over the first 18 years. And then we're down from 18 million. And the majority of that was allocated, as I'm sure many of you are aware, in our most recent grant process. So the first year of our work, starting in 2022, when the council was first established, really was focusing on laying the foundations and the groundwork for what this council would do moving forward. And when we started, we were developed through a statute and bylaws. In theory, there was a lot about what this council would do, but we needed to make that a reality. And so this group, or really the past group, spent the first year trying to lay the blueprint for what this council would do and really set the tone for the next 18 years. Part of that process was conducting a public survey and doing a community feedback session, just like we're doing here today. And through those processes, what the council did is they combined all of that feedback and looked at really what the public wanted to prioritize with these funds. And then from there, develop priority strategies among all 4 of our pillars. And for our prevention pillar specifically, what we decided to do is form an ad hoc prevention group, which would further analyze those results and also make some recommendations of their own to the council. We only had really Liz Blackwell Moore was still on our council for the prevention seat, and so it was important for this council to have a few more voices and perspectives so that we could make really informed decisions moving forward. I'm trying to move this like you all can see it too. As part of that first year's process, and after we had really understood what it was you all were looking for, this council went forward and allocated $9 million last December, and money was allocated in all 4 of our pillars. We've adjusted those allocations a little bit, but for harm reduction, we are providing funding to certified and operational SSP sites throughout the state. We are also providing funding and prevention to support youth organizations, as well as to provide flexible whole family service funding through potentially our CAP agencies, and to make sure we have a whole family approach to some of our services. For treatment, we are providing funding, which we are very proud to do to Milestone as well as Tessa's House to ensure that our detox facilities and residential rehabs are able to stay up and running, and also to get a new detox facility in Knox County, which we're very excited to support. We are also providing some planning grants to Franklin and Androscoggin County to help them figure out some of their needs and help them move forward with next steps. And we are also very proud to have supported the Recovery Wellness Institute. I see a couple of you all are here, which they've started up in Piscataquis County, the first recovery center there, which that money went out this summer and you all are up and operational. So congratulations. From this initial allocation, and again, with all the feedback and input we had received from you all, the council moved forward and knew we needed another sort of community funding opportunity, right? We'd heard from you about what you needed, but we also needed to provide you an opportunity to actually apply for these funds. And so what we did all last winter and spring was try to develop what this grant process would look like. And in early summer, what we did is we published our letter of intent, which was the first of a 2-phase process for us. That letter of intent was open to the public. It was sort of an open call for, hey, what sort of funding support do you need? Tell us about the projects, tell us about the amount of funding you would like to receive. And again, that was another really key piece of information for us in developing what this grant process would look like and how to develop something from scratch, really, that would best support you all. We received, as I'm sure many of you are aware, over 220 letter of intent submissions for a variety of projects across the state. And again, in not our prevention pillar, but in our treatment, recovery, support, and harm reduction pillars. I can say there were some really innovative and incredible projects, and you all are really doing incredible work every day. And to see the support that's already in our communities was outstanding, and also to see the ways in which you're trying to address the needs and gaps and asking for support to do that. We had an initial evaluation process with those LOIs that was difficult. There was many that we needed to work through, and again, developing this process from the very beginning, we looked at some of the key pillars for evaluation criteria, looking at how these funds would go and support your projects, how you're going to support abating the opioid epidemic. And ultimately, we selected 168 projects to move forward and submit grant applications. That grant application was published in October, and we received 129 submissions ultimately after about a 6-week period. We went through a process with that that was sort of 2 steps, as many of you probably saw and are aware. We had one council meeting where we reviewed the grants by the average evaluation score. So we really focused on those top tiers and the ones that scored the highest in this process. And there was consensus amongst all of the evaluators. From there, we passed a preliminary package and then said, okay, we have some really strong applications and we need to make sure that we're looking now at other areas of focus. So we then looked at our applications from a slightly different perspective and looked really more at target populations, service areas, priority strategies, and how to make sure we were passing a package that not only provided funding to all 16 of our counties, but also really focused on some of our target populations and making sure to the best of our ability, this funding was well-rounded and supported as many folks as we could. I have a graphic up here for this spread of those projects, which I won't try to walk you through now. But I do want to tell you a little bit, about what comes next. So the focus for the Maine Recovery Council and really for me as the coordinator right now is to get the grant funding out. And it's no secret that our contracting process has not been the best. And so we're working with a consulting firm to come on and support us in that work. And making sure we have all of our grant documentation materials moving forward in that sense. We're also looking to provide feedback from those who applied, and those who received funding, sure, but maybe more importantly, those who didn't. We certainly have our perspective on what this process was like, but hearing from you all and giving you the opportunity to provide us that feedback is so crucial for us. And again, this was the first time we've gone through a process like this. And the only thing we know we can do is make sure it's better the next time. And your feedback will be paramount in us doing that. And I will be sending out a survey to folks who applied so that we can get your direct feedback. And I'm sure, today if there's comments, those are very much welcome as well and will be heard. I'm also really excited about what the next sort of phase can look like now that we have, again, 220 projects that we've sort of cultivated in this database across the state, where we can now look at ways that we can partner with other funders, with the subdivisions to really help build collaboration across the state and make sure that there are other opportunities for you all who have applied, because we are certainly more than just a funding source. We really do want to focus on building those partnerships and helping to use this council's funds and the time that we have, which is very unique over the next 18, I guess really now 16 years, to do something that is needed for the state and to help support our community in a way that maybe other organizations can't do. So that is, again, something I'm excited about, and for all the time and effort and energy that so many of you put into applying for these funds, it is the very least we can do to support you in next steps and try to facilitate some of those for you. So more to come on that later. And for now, I'll pass it back off to the council and Pat, I guess.
Thank you. Thank you, Mary, for the overview. Certainly, again, we have certainly learned a lot in 2 years. And are part of the work that we did, and again, looking to improve as we move forward. And one of the areas that we will be concentrating in on is contracts and getting those contracts out and working with our grant partners. And that's what we'll do. So at this point, we are going to turn it over to public comment. And I just want to say a few things before it starts. So we're asking the people here, try to keep it to 3 minutes. I will signal you when your 3 minutes is up, and hopefully you can wrap it up. And after you give public comment, members of the council will be able to comment on that and ask either questions if the person is willing to answer, or give feedback to whoever is before us. We ask that you be respectful. To know that we all have different views and come from different places. And so it's about all voices here today. So we need to listen to that. I also, before we start, want to make sure the council members know that you are sitting up here till 1. So please feel free to move around, get up, do what you need to do. It's not that they're not interested in hearing what you have to say, but again, they're on to do that. I also want to share with you that we have a few members who wanted to stay, but for business reasons, they can't. Representative Stover will be going to the Hall of Flags, and Ben will be going back up to do his work as the treasurer of the state, and he'll be doing that. And I think those are the early people that may have to excuse themselves at this point. But note that they are interested in what you have to say, but again, there are conflicts. So unless there's other comments to be made here, I think we will move forward with public comment. And we will go in order of sign-in. And please excuse me if I can't read your writing and I pronounce your name wrong. But the first one here is Greg Henderson. Thank you.
Yes. Good morning, I'm Greg Henderson. I grew up in Central Maine. I reside in Greenfield currently. I've had the honor of working with students in Maine schools for more than 20 years in the roles of school counselor and school administrator. I appreciate the opportunity to speak with you today regarding how expanding implementation of the BAR model in Maine schools directly supports the goal of preventing substance use, as well as helping our youth become knowledgeable and empowered about handling the sensitive and complex issues connected with substance use and abuse. I became connected to BAR in 2015 while working at Skowhegan Area High School as part of the team, looking to be more effective in our approach to supporting our 9th grade students who needed much support. After 1 year of BAR implementation, our 9th grade students went from having the highest absenteeism rates, highest failure rate, and most discipline of all of our grade levels to the lowest rates of absenteeism, highest academic success, and lowest discipline. At the conclusion of our first year of utilizing the BAR model, we shared the success data and stated with confidence that the BAR team had fundamentally changed the high school experience for our 9th grade students in 1 year and set them up for continued success. Since then, I've continued to work with BAR and 2 other school districts and have come to the conclusion that BAR is simply the way the schools should work. While all 8 of BAR's interlocking strategies support student success, the specific Community Connect strategy is designed to connect specialized resources such as school counselors, resource officers, administrators, social workers, nurses, and community-based resources to students experiencing major challenges or barriers to school, such as substance abuse. In my current work as assistant principal at Mount Blue High School in Farmington, where I oversee the BAR program, every week the Community Connect team deals with the challenges of students directly experiencing addiction or the impact of addicted family members. The team develops and implements specific interventions, evaluates the success of those interventions, and adjusts as necessary. It's often the work of the Community Connect team that brings substance use issues to the attention of parents and guardians. The intentionality of BAR changes the nature of how schools work with substance use and abuse issues from an unstructured or haphazard approach to one that is focused and gives educators the tools and training required to maximize positive outcomes. Through a robust training program, BAR team members are trained to look beyond grades and other academic measures to intentionally create positive relationships with students and to leverage those relationships for positive results. Interventions are often a direct result of BAR team members checking in with students and then bringing their observations or concerns to a team for consideration. The BAR model takes teachers out of their individual silos and places them on a collaborative team. As the Maine Recovery Council considers opportunities to prevent addiction and provide effective substance abuse recovery, please consider the substantial role that public schools, which is an established network of professionals across the entire state, can have in supporting the recommendations of the Maine Recovery Council Prevention Ad hoc Committee through continued expansion and support of the BAR model. Thank you very much.
Thank you. Thank you very much. Questions?
Yes, I just have a quick question. I'm curious. I was knocking. I know when we had looked at. Sorry, when we had looked at when the BAR had come forward, when we had looked at it in the first year, Department of Education did not have funding for the second year for some of the schools that they were working with. And then they did find the funding for that for, the 90, I think it was upwards of 90 schools. You may not know, as somebody who's implementing at the local level, I'm curious if you do know what the funding looks like, sort of the picture for DOE for future BAR years.
Sure, I'm not speaking at all from a position of
Yeah.
absolutely informed, but my understanding from being in that community is that's their short-term funding situation.
Okay, thank you.
I can share with you that it's very important. I worked 4 years as a unique position in a high school that I was a substance abuse counselor within a high school. And the support that kids need. And my job was never really about substance abuse counseling. It was really about support and caring and making an environment that made it safe for them to be who they needed to be. So again, the council is aware of the work. We do have a round of prevention funding that will be there, and hopefully we'll be able to talk more, but your work really is essential. Thank you.
Mr. Anderson, can you give me you may not know this, so this may be an unfair question, but I'm just trying to get a understanding of how widespread is bar in use now across Maine. I mean, you know what I mean? And primarily in high schools?
So I'm not speaking on behalf of the Bar Center or for other schools. My understanding, I think we're at 95 or 96 schools in the state. Those are individual schools. You may have multiple schools in one district, and some of them will have bar, and some of them don't. Early in the evolution of the program, it was really targeted to ninth grade students, but it's expanded to upper grade levels and lower grade levels today. So I believe we're at a K-12 model at this point, although I believe that historically, because of the way the model rolled out, that it's dominated by high school.
Oh, just a quick follow-up. I'm sorry.
Go ahead.
I have no idea how many schools there are. If you ask me how many police departments there were in the state, I could tell you about it. It's 400 and some odd town, 490 some odd towns, right? 93, 92, something like that. How many schools? Do you know approximately?
No, I do not.
Sorry, unfair question.
There's at least a school for every police department.
It's got to be at least, I'm sure. Oh, that's all right. Thank you. I'm just trying to put that, I'm just trying to get a sense of 95 out of 200, 300, 500, you know. That's okay. We'll get it. Thank you.
Thanks, Todd. Paul, you had a question?
Yeah, Mr. Henderson, thank you very much for presenting that. I've got two things. First, can you tell me what the acronym BAR stands for?
Yeah, sure. So BAR is building assets and reducing risks. How do you build up those skills that students need to be successful while reducing risks?
Given the amount of schools in Maine and the amount of schools that are currently using BAR, I wonder what the cost statewide would be, and I wonder how Maine recovery funds could best be used to supplement the current funding.
So again, speaking only for myself, I think that the Department of Education and institution help facilitate how schools become connected to BAR and the expenses that are associated with the program is more connected to training and ongoing support that the BAR Center provides to schools to make sure that they're implementing the program with fidelity.
I'll just make just one comment. I think so. There's 126 high schools. I just looked it up pretty quickly here. And so I think there's probably a similar number of middle schools. And so there's middle and high schools, many across the state. Most schools are moving into this multi-tiered systems of support, which is for academics and for behavior and well-being. And I think BAR is a way in which schools can do that. I think all schools are working on their multi-tiered systems of support, and BAR is a one and a great model for doing that. I think there seems to be there was funding for it, and now maybe we should find out more about what is the potential for funding from DOE and other sources to figure out how we might be able to support what might be the best use. I mean, the Maine prevention or the prevention work group has recommendations, and I'm not, we'll have to see how those fit into what the recommendations are. See how BAR might fit in with those recommendations, but.
Thank you, Ben.
Just another question, Benjamin Mann. Do you have a sense of how the funding that DOE currently provides is is actually applied in the school system? Are you hiring, did you hire staff? Is it for training materials? Is it for the curriculum that you're working off of for the bar system?
Yeah, so the program really relies on. After 3 years, the maintain program that has been funded, so that getting off the ground. Documents that are purchased, so it's really about the training and the practice and getting schools to operate independently after.
So mostly the request, the higher expense is the training aspect up front. And then most schools are able to maintain it within their own budget as it progresses, sort of. That's just a short version, but.
Yep. And I can speak for other school districts. I know that RSU9, where I work at Napa High School, does provide some financial support for teachers or staff members who are on the team through stipends because it is a substantial budget for those folks.
Thank you very much. Good luck and thank you for the work that you do. Thank you. Next up is Robert Rogers. If you want to pass them out, we can do that.
Hello, my name is Robert Rogers. I'm the Director of Substance Use Prevention and Drink Services at Kennebec Behavioral Health. I reside in Clinton and work with Skowhegan, overseeing our PBO, the Preventing Prescription Drug and Opioid Overdose Related Deaths Grant. I want to take a few moments to acknowledge the Maine Recovery Council for their work and thank them for their recent approval to fund 2 projects in Somerset County. Somerset County Risk Reduction and Syringe Service Project and the Somerset County Recovery Support Center will serve residents of Somerset County and surrounding communities in ways that have not been possible up to this point. So sincerely thank you. Kennebec Behavioral Health is a certified community behavioral health clinic, or CCBHC, offers essential support for individuals seeking treatment or in recovery from mental health and substance use disorders in Kennebec and Somerset counties. CCBHCs provide immediate access to 24/7 crisis intervention services. We offer a comprehensive range of services, including outpatient mental health, substance use treatment, primary care screening, and psychiatric rehabilitation, all designed to address the diverse needs of individuals. For people in recovery, this approach ensures that treatment is tailored to their specific circumstances, promoting a supportive environment for recovery. The clinics coordinate care across various systems, such as physical health care, social services, and criminal justice, to provide holistic support that addresses all aspects of a person's life. Importantly, CCBHCs are accessible to everyone, regardless of their ability to pay, place of residence, or age. This inclusivity ensures that mental health and substance use services are available to underserved populations, helping more people achieve and maintain recovery. Maine reported 9,274 non-fatal cases in 2024. Few of these individuals are screened for brain injury or referred to brain injury services. We must think about what this means for people who overdose multiple times or regularly have those near overdoses, which can involve oxygen deprivation to the brain. Through our CCBHC in collaboration with the Brain Injury Association of Maine and America, we have implemented screening for brain injury for people with substance use disorder or those who experience domestic violence and or overdose. With frontal lobe damage, survivors of overdose may have issues with compliance with program requirements or follow through. As we think about stigma, these individuals are often labeled as non-compliant, pre-contemplative, or lacking engagement. The reality is they may have a strong desire to be in treatment and stop their use of substances, but lack the skills to be successful. Accommodation and skill development become necessary for people with brain injury to be successful. Again, thank you for your time and service to the state of Maine. The financial support you have provided to Somerset County is greatly appreciated. We look forward to sharing our results with the council in the future.
Thank you, Robert. Thank you very much. Thank you for the work that you do. Questions, Paul?
Thank you very much, Mr. Rogers. I can't agree more with your statement, and because of the association of brain injury with substance use, I think it's very important that treatment programs develop low barrier programs and not release patients from their treatment because of missed appointments, late, things like that. A question to you, a lot of the patients I treat have brain injury, most non-diagnosed, but you can see it. And I struggle getting referrals for evaluation for brain injury and then treatment for that, and how does that relate to the substance use treatment that I'm given?
So part of our screening protocol that we're doing in conjunction with the Brain Injury Association is to actually collect some data so that we can determine where is the need, so that we can then also look at what funding needs to be allocated. We know that there are capacity issues. We're very early on in this pilot program, but I can say so far, every single person I've conducted screening with has screened positive for special brain injury. So I think we'll have some interesting results and just the awareness to the individual. So one comment from one individual was, I had just felt so stupid my whole life. And had never put into context and has never had a conversation with a medical care provider about the potential for a brain injury. So just being able to have those conversations and being able to train and educate providers.
Thank you.
Robert, thank you for recognizing the need and not creating any more stigma that is already there. Your work is important and council appreciates it. Questions? Thank you very much. Looks like Sean Parker. Welcome, Sean.
Hi, good morning, Madam Chairman, members of the council. My name is Sean Parker. I'm here to speak on behalf of my organization, provides medication assisted treatment to 887 patients at our 2 centers in Knobstock and Rockland. So those of you who were on the council during the previous cycle, I created stewards of this funding, making those hard decisions on the programs to be funded. We all appreciate the difficult choices that you had. For those of you who were just joining the council, thank you for taking on this task. It's not easy, but it is truly exciting. New Season, which was founded in 1986, has been providing services to many patients since 2005, when our Knobstock Center. Methadone has been clinically proven to be the gold standard for treatment of opioid use disorder, and medication-assisted treatment providers are at the forefront of this battle of the opioid epidemic. This council has previously allowed for-profit agencies to apply for funding, and I've asked them, imploring you guys to continue that stance. Organizations like mine can utilize these funds to assist with reducing barriers our patients face, from access to concerns, paying for Ubers, or putting mobile units out to go into the communities, to assisting with just patient needs, buying lockbox, their medication is safe and their children will have access to it, to assist them with housing needs. These funds are truly essential part of community organizations and assisting people in their recovery. Thank you for allowing me to take a minute to speak on behalf of New Season and all medication assisted treatment providers within the state Thank you, to communications in the room and those watching on the screen for all the hard work in saving lives every day. We do make a difference. Thank you.
Sean, and thank you very much, and thank you for the work that you do. And you know, I am grateful that medication assisted treatment is available for people. Because as we all know, there's so many roads to recovery. We all have a different path. That is. Questions? Any questions? Well, again, thank you for your work. Again, I've been at this long enough to know, come a long way from the filling up the Bangor Civic Center to not open that clinic to opening clinics and getting people the help that they need. So it's been a good journey. Hopefully it'll improve. Thank you.
Thank you.
Karen, I believe it's Hardy. And while Karen is there, let's welcome Chastity Toole back to the council. She has been sworn in back, I believe, so she is back here. Would you like to quickly introduce yourself, Chastity?
This on.
And
then I turned it off. Hi, everyone. I'm Chastity Toole. I'm a harm reduction consultant from Washington County. And sorry for my lateness. The roads on the east side of the state were not great.
Thank you. Thank you.
So, first of all, I wasn't sure if I was something about photo, but I agreed to do it. As you're on, and I'm glad that you found it. So my name is Karen Hardy. I currently reside in Belgrade. I'm here in a dual capacity role. I'm a mother whose son is currently 7 years heroin-free, prescribed and taking Suboxone to support his recovery. And secondly, I'm an LCPC and certified addiction counselor. I own private practice in Belgrade. What I want to share today about and my thoughts are about addiction is a family disease. My appeal to the committee today is that there be some funds used toward, and pardon my possible ignorance of what might be out there that I'm not aware of, so I won't say that, because I could maybe think. But these were my thoughts. Funding for used towards increasing family inclusion and treatment. During all of the treatment episodes my son participated in, there was minimal involvement with family to support and inform his treatment. In a 30-day program, for instance, we spent 6 hours in a group of other family members or loved ones and a counselor out of the full 30 days, and then left to our own devices. Research has shown that when there's family involvement and support, the long-term outcomes of recovery improve. My experience and observation are that family and individuals resort to disconnection from each other in order to support in their lives. It takes immense effort, professional or community support to recover together. My son and I worked hard to overcome the historical family influences on his use of substances. It was a family dynamic that contributed greatly to his use. I once inquired about the families of those who regularly attended the local recovery center and where they go for support. That person said, most of us here are orphans. I did not hear that as a literal meaning of the word, but what I spoke to previously about disconnection and estrangement from family. It hurt my heart. And I believe it. Interested in being a part of some type of program that can include family more intentionally as part of a fuller recovery experience for individuals in recovery. The issues and information that come to my mind that can be provided are things such as education about addiction, communication, which is really big word and really bigger issue than just talking, communicating effectively, opening in and understanding of family dynamics and how to build or rebuild relationships. And
Thank you for sharing. Comments from the council? I just want to share with you that it is I've been at this a long time and it's long overdue that we don't start serving the families that have been affected. Your stigma has caused silence and isolation that doesn't need to be. And so let's hope that that we can move forward and support and help families that are out there because they're there and they're afraid to speak, whether that's stigma or whatever. And I thank you for speaking up and sharing your story and the work that you do.
Is there space or like how that might happen?
Well, we don't know. Again, we can continue to look at gaps in services, particularly in this round. Remember that we do have 20 years of funding here. And it certainly, we will look again, if that's a gap in services, which I believe it is, the council will be looking at that. We awarded some funds in the past year to some family services, but certainly it was not enough. And I believe, again, as we look at the state and look at, and I don't say that lightly, but we look at gaps in what people need. I'm sure that will become at some point in time at the top of the list. So thank you very much. And thank you to your family. Thank you. Barbara Skinner. While Barbara is coming down, I just want to remind people that if you wish to speak, you have to sign up in advance. The sign-up sheet is in the back of the room, and just put your name on there, and we will give you the opportunity to speak. Thank you. Hi, Barbara.
Barbara Skinner. We are so thankful we got the money from the council. Since we've gotten that, we've done our renovations, including some conference room. Anyone that's been out there would say that it looks very homey and comfortable. That's what we get from a lot of folks. Georgia and I even thought that it would be really slow starting up. But to our surprise, we have 35 folks from the community coming in daily. We had a sewer break and was looking at $6,000 for baby care. We paid $350 for evaluation program problem, and all the rest of the repairs were done by community members. We're finding out how wonderful our community is. We're getting nothing but really good responses on what we're doing. Since starting up, we've had a couple of different events. We've had a Halloween event, Thanksgiving dinner for folks on Thanksgiving Day. Pretty much everything that we've done, I have no plans of having donations for the food on Thanksgiving Day. I was just going to do it. We have an extra turkey in our freezer right now. I cooked 2 of them. We have a Christmas raffle right now in progress. Our community has given us $4,000 worth of different items because of the different places that I went and spoke to. Again, great reviews here and one of the things about what we're doing. A couple of places that you told us if we have anyone that wants to get back to work, whether they have legal issues or whatever, they want to get a chance. So we have the names down for that. I can't even say how I want to cry sometimes. The help coming from our community, and the thanks for you guys to help us get this. It really got. Like I said, that wasn't planned for that Thanksgiving dinner. Alan will be hosting a plant coffee film on Christmas afternoon for folks that want to be out, not be alone. We have a clothing closet. We're giving out, I would say, 10 to 15 warm jackets for boots to folks. That was given to us by the Piscataquis Valley adult vet at the clothing closet. They asked if we wanted to take it over, and we did. We have weekly recovery circles, it's an all recovery, so anybody doesn't matter what they're recovering from, even if it has trauma, which I shouldn't say just because that's huge. I do a weekly craft session, everything that goes on our page, what we're making. Those have been really cool. We have folks who have someone who was gonna come do reefs with us yesterday, but rather is coming next week. The SAFE program, which is run by Penquist, they came out to the top one night. To the family members. And the SAFE program is generally the middle school up. And a question was said, what about the younger kids? Say is substance abuse. So one of our volunteers said, I would want to run that center. Yesterday, Alan went with his wife and some kids and wants to make $1,000 for that program. What they want to do with the kids. NA and NARNA is now meeting at our facility, which makes us thrilled. The gentleman for NARNA is coming from Bangor because it means so much to him. We had the psych nurse from, I always say Mayo, Northern Lights Mayo, come out and let us know that he's going to come out and meet people at our facility as well. They can't really get to Milo where he normally is. And we spoke with yesterday, we spoke with Mackenzie. All three of us have been trained in recovery coaching. We're going to start doing that to the behavior as well. I think I covered a lot of what we've done so far. We wouldn't have been able to do any of this without council, and we are so thankful. And I just ask that you guys really look at the rural areas. Just hearing from our area how important this has been to them, for us to be there. Really concentrate on rural areas. Like our team that's used over the study, and we haven't been what they do have is limited. I shouldn't say nothing. Very limited. It's not so much to our community.
Barbara, thank you. Comments? Gordon and I happened to be there at the opening of the center, and it was wonderful. Peer recovery centers for me are just this: you walk in and there's hope. And so for the Piscataquis County, this really was a gift, and it was so refreshing to hear that the community came together when that sewer pipe went. Again, it shows that you're welcome. We're going to be here, and so thank you for the work that you did. Yeah. It's a good thing. It just shows community comes together. Barbara, thank you for sharing that with us. And good luck. And I'll stop by when I'm up there this summer. Maybe I'll come to the craft thing. Thank you. Alan Burgess. Hey, Alan.
Hi. So my name is Alan Burgess. Said I'm from Guilford, and I'm here representing the Recovery Wellness Community Center. And I want to start by thanking the Recovery Council, along with the Attorney General's office, for making the Recovery Wellness Community Center a reality. As a person in recovery from Guilford, I know how hard it is to find recovery program. It's not just the lack of resources that's the problem, it's also the lack of knowledge of recovery that plagues our small communities. Generally speaking, we ask help from our well-intentioned family and friends. They care a lot about us, but have no experience in recovery. They tell us we are strong, to think about our loved ones, and that we can do this. Well, these words are kind and come from the right place. Those of us who struggle with substance use disorder know that those kind of words of encouragement are enough. In fact, in a lot of cases, they have the opposite of the intended effect. They make us feel more hopeless because we wonder why these thoughts can't make us happy. I tell you this to explain why I believe recovery centers and other investments like this are so important to our rural communities. When I was first looking for recovery, I was completely lost and very confused on where to go and who to ask. Luckily for me, I knew some people in Bangor who steered me towards resources in that area. I was also forced to cut transportation back and forth to Vancouver, which is an hour away from our small area. Transportation is a luxury many people struggle with addiction to. Things are different in our area. There's a place nearby that offers peer support, resource programming, and all sorts of recovery meetings. The importance of this cannot be overstated. Our rural areas tend to be low on money and overrun with substance abuse. Since our center is open, we've seen an explosion in attendance at our recovery meetings. We've seen the substance affected youth find a place to come together and learn they are not alone. And very soon we'll be offering recovery coaching. Probably my favorite story so far has been seeing a person walk through the door looking for detox. The next morning, that person is on the way to detox. It was never possible in our area. Didn't know where to go to recovery. You know, I've seen this, like, I was having a conversation about recovery coaching and with, you know, with healthy kids, really good conversation, and we're asking questions, you know, expect people to come in looking for a recovery coach, but my experience is, generally speaking, people in our small areas that are deep in substance use don't know what a recovery coach is. They don't know that they need a recovery coach, they don't know what they're looking for. They've never heard of basic supports, right? So what they need is to just say, go there, just go there. You'll learn and find out. Generally speaking, people that are active in recovery know what recovery coaches in our smaller areas, communities. We don't. We have a lack of transportation and a lack of information about the resources that are out there. So I've had the privilege of seeing what our community looks like with and without this sort of help. Thank you for letting me speak. And thank you again for what you've done. Lives have been changed.
Thank you, Alan. It is a great center. I like it when you go there because you see the families out there, see the kids running, see the family there. Alan's put his family to work. Which is a good thing. It's a good thing. Any questions for Alan? Thank you in sharing with us that our investment was well spent. Thank you. And do you have power in Piscataqua County? Question of the day. Linda LaJoy? Ahoy?
LaJoy.
LaJoy. Is that all right the first time? Thank you.
Good morning. We're going to be coming from a little bit of perspective from the many people that have spoken so far this morning. I'm an affected adult, and I have lived a life of abuse and so trauma survivor. I've struggled most of my adult life with mental health issues, and I've spent so much time on counseling and money out looking for the answers, looking to become better. Most of my counseling sessions, medications, nothing has brought me, nothing has had a positive effect that say they're not recovering from substance. I stopped in there one day on a whim, happened to go by, saw the sign, and I'm like, oh, I have a friend. So I stopped in to get help for them. Little did I know how much help they would offer me. At the time, I was dealing with a lot of what I thought were friends, but were not really connections. They were connections. That's the way that I look at it, was what could I do for other people? How could I help them? And I thought about helping me. That was selfish and serious. So just having Alan and Linda and Margaret just all welcoming parents, the positive effect they have on me is incredible. Their empathy, encouragement, non-judgmental, just that an experience I've never had in my life. That was back in August. And at the time I was existing. I was alive, I was existing. I was functioning. But it wasn't really living. I had, again, the confidence, no connections. But since hanging out at the recovery center and volunteering And they keep thanking me for volunteering, I'm like, no, you're not thanking me, please. But it's done far more for me, I'm sure that I can turn to that. But since hanging out with these wonderful folks, I have since, actually just been accepted into the University of Maine. Health and Human Services degree program, something I started. That never finished.
Excellent.
Yeah, and I am also the brand new, just started this week, workforce. Yeah, workforce development specialist in a donor office, and that is definitely thank you, Barbara. But they gave me the incentive and the courage and the confidence to go back and become the and feel healthy and do these things. And I'm only a happy other, and I see people every time I'm there that are recovering or starting recovery or wanting to recover. That community and that's fantastic things. People are really working hard. It's just so heartwarming. And I honestly believe that I owe my life to our Richard family. Thank you.
Thank you. But Paul has a question, Linda, if you might.
Sorry. Thank you very much. I feel that building community and recovery centers are part of that is so important as part of treatment. Many of the patients I treat for substance use disorder are trying to be in recovery alone. They've isolated themselves, and despite being doing well avoiding substance use, so in treatment they're successful, they are not building community. And I really struggle to influence them to help to build community, though we have recovery centers available where I work or in that area. Someone like you who has discovered the recovery centers, how would you suggest that I influence my patients that are trying to recover alone?
Well, and that's a hard one because I can talk all day long about things that, I've experienced. But quite honestly, and somebody could have told me, oh, you just need to go to Bangor, and again, I live 3 minutes walking to the recovery center, so I'm just passing in every day. If I had to go somewhere and make a plan to go somewhere, such as Bangor, I would have gone. I would have gone, wow, that sounds great, yeah, I'm gonna get to that sometime. But having it right here in my backyard just made it so easy and so positive. And once you get through that door and you're feeling these positive vibes and, they're just encouraging you, not judging you. That's one of the biggest things, no judgment. It just makes you want to go back. And so just getting that through the door at that one or two times, you're gonna want to go back. You're gonna want, and of course the rural areas, like I heard said, it's so important because I believe that so many people that we see come through those doors on a daily basis probably would not go there if they had to travel an hour to get there. They might not have the means. They might be able to walk or hop a ride, 5 minutes down the road, 10 minutes down the road, but it might be a different story if they have to travel for a work. So, yeah, I wish I had a great answer for that. Like, I just getting in the door once, and the rest of taking of itself. If you have say.
I think he gave us one of the answers, and that is that rural is important.
It is.
It's important that it be accessible, that if there's only one in the state, you gotta get in a car to go there. You don't know how to do that.
Exactly.
But Linda, we wish you well. Glad you're going into the workforce because we have a shortage of good people in this workforce. So that's a good thing. And I hope you do well in your studies. Thank you. As a reminder, again, people, if you're want to speak, make sure that you're signed up in the back. Julie Rancine.
Thank you, council members, for allowing me to share my thoughts on priorities for the settlement funds, and also to share more information about how our community is doing where I'm from. My name is Julie Racine. I'm a family psychiatric nurse practitioner, and also the executive director of True Connections Behavioral Health Services, which is located in Lincoln, Maine. And for those that are not aware, we are in northern Scott, southern Aroostook, in the middle of, I'd like to say nowhere, where there is that gap. Yes, that's included today. I'm also specifically a resident of northern Penobscot in southern Aroostook, so daily I see firsthand the devastating impact of the opioid crisis on our community. True Connections is a new nonprofit organization that provides both mental health and substance use treatment. We provide a well-rounded service of medication-assisted treatment, psychiatric medication management, case management, and also substance use counseling. I've seen, like I said, firsthand, the devastating impact that the opioid crisis has had on our community, and it's leaving a trail of destruction into the isolation of rural with limited access to health care has only exacerbated the problem. Many individuals struggling with addiction are unable to access the treatment and support they need, as many have already talked about. In our region, especially long distances, transportation barriers, and shortage of providers create significant obstacles to care. In addition, stigma surrounding addiction has further compounded the problem. In rural areas where everyone knows everyone, seeking help for addiction can be particularly daunting. Fear of judgment, shame, and social isolation often prevent individuals from accessing the care they need. It's, in my words, cast a long shadow over our community, affecting countless individuals, many who are suffering silently. Especially in these isolated rural areas, addiction often goes unnoticed, hidden behind closed doors, living in the woods, isolating in tents, and often abandoned buildings that no one even knows about until you go on those woods rides that we so often talk about. Unfortunately, close-knit communities often equate addiction with moral failure, which is where the need for further education comes in. Sadly, the opioid crisis is also having a devastating impact on our youth in our community. Witnessing addiction firsthand is leading our young people to make harmful choices, putting them at risk of early drug use, and it's devastating, sometimes taking their lives. In rural areas where substance use is often normalized and help is hard to find, these young people especially are vulnerable to this cycle of addiction. The opioid crisis has stolen the futures of too many young people in our community already. As a provider, I've witnessed firsthand the impact of addiction on our youth. It's heartbreaking to see the potential of these young lives lost. Given at True Connections in the short time that we've been open, we've seen a surge in teen referrals, a stark reminder of the urgency of this crisis. We've been open since August 9th, and we're currently already serving close to 200 clients and have close to 100 clients already on our referral list. Some of those, unfortunately, are youth. We must act now to protect our youth and provide them with the support they need to break free from addiction. Already in the past couple of years in our small communities and surrounding areas, we've lost 5 youths already to overdose or drug-related deaths. I believe that True Connections is uniquely positioned to provide assistance to these rural areas. We're currently on the verge of a strategic partnership with one of our local hospitals, allowing us to offer immediate treatment to individuals seeking help with establishing a satellite office on the hospital grounds to ensure easy access to essential services. For example, when people are sitting in the ER and need that immediate service. Additionally, our close collaboration with peer recovery centers provides vital support and resources to individuals in our recovery that are looking for recovery. Yesterday, I had a conversation with the peer recovery center, who had an individual there who needed immediate assistance and need of medication assisted treatment, demonstrating our commitment to providing immediate care. And I'll be seeing that individual tomorrow. Would have been today, not because I wanted to be here, but because of transportation. And this is just one example of the frequent conversations that we have at True Connections with our local recovery center. To assist with building this foundation, True Connections plans to harness unique abilities of peer recovery coaches. We're currently in discussion with an organization to develop a comprehensive training program that will provide peer recovery coaches with the tools and resources they need to succeed. As individuals in recovery themselves, peer recovery coaches can challenge stigma by sharing their personal stories. Last week, at True Connections, we required the assistance of our local EMS to assist with transporting someone to the hospital. Sadly, I was horrified at the interaction that took place between the EMS provider and this individual. Not out of, I don't believe it was out, I believe it was out of lack of understanding and lack of education, where peer recovery coaches can also assist us with providing this training to even our community members. Peer recovery coaches will be able to provide additional support and motivation, and we also want to be able to deploy them immediately to the individual instead of trying to expect the individual to get to us. We're working closely also with our probation officers. I've presented at our schools and in daily contact with them, and believe that these peer recovery coaches will also be an outreach to provide the needed direct support. So by providing our clinically trained clinicians that we have that will work together with these peer recovery coaches, I believe that we can strongly address this gap in this rural area between Bangor and Holton is how I like to see it, but it's also, then there's outskirts of Milo and Maxfield and places that some people unfortunately never even heard of. So with this information, I'd like to ask the council to consider supporting True Connections with this funding to provide peer recovery coaches, especially to our rural communities. On a personal note, I'd like to share that I'm also an affected other. You know, that was going to do that. Even as someone who works in the field, I was not able to prevent a loved one from taking his own life to suicide after having a lifelong battle with his own mental health and substance use. I watched firsthand the impact that living in a rural area with lack of services and support that can have on someone's life. However, this only empowered me to help to make sure that others won't have to experience this alone. Hence the name we particularly chose when we formed our organization, True Connections, to, like we've all talked about already, this sense of building community and those healthy connections. So thank you. Sorry for your questions. Well,
Thank you very much for sharing your story. If you have currently today, if you have someone come into True Connections that needs that's looking for medication for opiate use disorder, what are your options to get treatment today?
If I would as also the psychiatric nurse practitioners, I would probably make sure that an executive director make sure it happened that day, and it's happened.
And are you able to provide that at True Connections, or do you have to go somewhere else?
No, we provide Suboxone. The only thing we don't do is methadone there.
Okay.
Yep.
And you have the availability of a psychiatric nurse practitioner that could see a patient kind of on a as needed basis right that day.
So currently, that would be me.
That would be you.
That would be me, and I've done it.
Excellent.
Yeah.
Yeah. It's kind of the funnest thing to do, isn't it?
It is. It
Yeah.
is when you can say, yes, I'll be right with you,
Yeah.
or have a seat, don't leave.
Yeah. Okay.
It's very rewarding. Yeah.
Thank you.
No, go ahead.
Just for clarity, do you provide MAT as well as other psychiatric medications when you use the word medication management?
Yep, we do. So we can treat co-occurring.
And can you tell us a little bit about that need? That's such a huge unmet need.
It is. Yep. So the need for co-occurring, it's very few and far behind, far that I see individuals that just need substance use counseling. There's always, if not some unrelated, or I shouldn't say unrelated, a related trauma or mental health need, whether it be depression, anxiety. And a lot of our individuals are self-medicating because of that untreated diagnosis.
So when you talk about referrals, is that wait list? When you said 100 referrals?
Yeah, and that's only because we can only see so many, open so many people a day.
Right.
Yeah, yeah. And if we can't, if it's an immediate need and we screen everyone, then, or if it's a service that we don't offer, we will refer and work with all of our agencies in the area that might have something open.
And what is the capacity for sort of medication management in your area outside of MAT?
So
A lot of like limited capacity for that service.
they would have to go to Bangor. Yeah, and people too often aren't going to travel to Bangor. No, and then to the north, I believe there is one agency in Holton, and after that you jump to Presque Isle.
You have funding for uninsured.
We do not. We actually have individuals though that we are seeing that have no insurance. Because we don't turn anyone away. As a nonprofit agency, we won't turn anyone away. Yep.
Thank you very much for sharing that information. Thank you for the work that you do.
Thank you.
Thank you. All right, I have here, is it Karen?
It is Madam Chair. The next name on the list is that my colleague, now may we go together?
You may approach Sam.
We drove from Fort Kent together, so we don't want to be separate.
I understand the county connection. I'm not gonna interfere with the county connection. One iota. Thank you.
Good morning. It's been a long day already. We left the county at 5 a.m. So thank you. Thank you for the time that you're providing us to speak to you briefly this morning. My name is Peter Karen. I serve as the coordinator of innovative practice and community outreach for the Valley Unified Education Service Center, which comprises 3 school units located in the Upper St. John Valley region of Aroostook County. And those are MSAD number 27, which is headquartered in Fort Kent, SAD 33, which is headquartered in St. Agatha, and the Madawaska School Department. And I'll let my colleague introduce herself.
Hi, my name is Brooke Netto, and I'm an alternative educator for Fort Kent.
I'm going to ask you to do one favor. Make sure you speak into the mic because people on Zoom are having some difficulty hearing. So thank you.
People don't usually have difficulty hearing me, but I will comply with your request. Yes, just trying to be gracious. So Brooke and I are here today to talk to you about the Upper St. John Valley Recovery High School program, which is one of the projects that was considered for funding by the Maine Recovery Council. And first, I think what we'd like to say is we were gratified that our letter of intent resulted in us being invited to submit an application for consideration by the council for the Recovery High School program, because there are no such programs in Maine. The Upper St. John Valley Recovery High School project would represent the first recovery high school in the state of Maine. There are 43 recovery high schools spread across 20 states in our country. 5 of those are located in Massachusetts. 1 of those is located in Rhode Island. Our objective when we started planning together with our colleagues at the University of Maine at Fort Kent in April of 2023 was to bring the first recovery high school to Maine and to really initiate a 3-year pilot project, which the result of which would be that we could help deliver or develop other recovery high schools in other parts of our state. Not only would the Upper St. John Valley Recovery High School program be the first recovery high school in Maine, It would be the first in the United States with a school week in residence model. And that is being met with a lot of enthusiasm by the chair, the current chair, and the immediate past chair of the National Association of Recovery Schools, because there are no recovery schools in rural states like Maine, where the public transportation infrastructure is a challenge. So we were gratified that we had the opportunity to submit an application to you. We appreciate the fact that the reviewers from the council scored our project quite high. That was very gratifying as well. We're proud of the work that we've been doing for the last 20 months in partnership with the University of Maine at Fort Kent. We've been deliberate, we've been responsible, and we've taken a very calculated, careful and thoughtful approach to both researching recovery high schools and developing a planning and implementation process to bring this project to life. So we really appreciated the score that reflected, I think, the quality of our work and the receptivity to the quality of our work. I want to also say that I can fully appreciate, having watched your meeting where deliberations regarding what projects to fund through this first release of funding, having watched that meeting, I fully appreciate the complexity of the task that faces you. I'm glad to know that we would be in consideration without having to redo an application for subsequent release of funding. But I need to be honest with you. Our window of opportunity for implementing the Upper St. John Valley Recovery High School program, as we submitted it to the council for 2 years of funding, could close. We, Recovery High School students and their educators, need to be separated by time and space from the regular school population. Our high school in S80 27 is located a stone's throw, literally a stone's toss from the University of Maine at Fort Kent. The two campuses abut each other. The University of Maine at Fort Kent has been holding a residence hall floor, a self-contained residence hall floor for 8 students and 2 dormitory parents. They've been holding a house on campus that has served as a student center until recently for use by our students and our teacher and our ed tech and our recovery coach for daily educational and recovery work and planning. And they have been holding a room in their dining hall specifically for use by our students and staff for breakfast, lunch, and dinner. At a recent meeting with Gordon Smith in Fort Kent, President Deborah Hedin advised him that they cannot hold those spaces indefinitely. The reality is that there are other groups interested in those spaces. The university kept them open for us 1 additional year, 1 year more than they had planned, because they believe in the importance of this project in our region, but they will not be able to hold on to it indefinitely. I appreciate the fact that there's some youth recovery support money coming forth, but that will be too late. For us to implement this project in 25-26, we need to know in January that we have funding forthcoming for 2 years, so we can begin recruiting staff and we can begin working with our 3 local high school administrations and counseling staff to identify students for the program. If we can't fill the program with St. John Valley students, we will extend it to the entire Aroostook County. It's time for Maine to have this service. I've been a school administrator for the better part of 40 years. And from my first year to this year, I see students struggle coming out of recovery programs, and we put them back into their regular high school setting. We're setting them up to fail. They do not succeed. They need a better option. That's how we end the intergenerational cycle that is part of the opioid crisis and the addiction dilemma that we're faced with in this state. I did not prepare written copies of these comments, but I know that you received an email the day before yesterday from an educational colleague, Mrs. Claire Nichols. She says it all. She's been on the front lines. And this is a desperately needed service. Brooke, did you want to add anything? Okay.
So we saw it all. She sent that through our email.
Yes.
Okay, so Mary will make sure that members of the council all receive that when she gets on their email. I want to let the council, do you have any questions?
Yeah, I want to thank you for coming here. I had the pleasure of reviewing your grant application. Do you get the results of the grant application? Do you get to see our comments?
I have not seen them.
Okay.
I have heard that we would have the opportunity. I have not seen
Okay.
them. I'm aware of the score because I attended the meeting and Gordon told us what our score was.
When I was reviewing your grant application, I was so excited that I kind of shouted out loud to my wife and was reading parts of it. I found the application to be perfect.
Thank you.
The collaboration between your organization and the college was so impressive. I think you had everything down to a T. I do not know why it was not picked, but I really want to see that again. And I request that you keep going, whatever way you can. And whatever I can do to help, I'll be more than happy to. Feel free to contact me.
Thank you. I appreciate that. And we are pursuing other avenues. We're in touch with our legislative delegation from the St. John Valley. We've been in touch with the Attorney General's office. We hope for an audience with him today. We did not get a response to that request, unfortunately. So we were, nonetheless, we were still determined that we would come down here and stand before you in person to talk about the importance of this project and the very real possibility that 20 months of work toward this end will be for naught, because legislatively, we will not be able to start in 25, 26. We will lose the momentum. We will lose the space to make this happen. So we thought it was important that we come and tell you that face to face.
Thank you guys for coming. I did not see the application, but I did read the LOI and was really impressed with that. But as you were talking, I was reminded of the fact that we do have an obligation to give 3% of funds to schools. And I just want to remind the council to really keep that in mind, because this could be it.
Thank you. Appreciate that. And I appreciate your driving in from Washington County. We understand less
Yeah.
than desirable road conditions.
Again, we have a member of the council who has asked for it to be reviewed, has asked it to be reviewed, and we will do that. I applaud your work.
Thank you.
As I shared, as someone who worked, fortunately, only 4 years at a high school, I can tell you the need is there. And also I had the opportunity working with adolescents and visiting some recovery high schools. They are a gift.
They are.
And so, don't let us stop you, whatever you do. If
Okay.
somehow it doesn't happen, you just keep at it, because it's important. And I really applaud the university for willing to be part of that. It shows a real community support.
And they've been wonderful partners.
So I thank you for your ride. As I said, a member of the council has asked for that to be looked at. We will take that into consideration.
And please drive careful going back.
We shall.
Again, don't give up.
Thank you very much.
Thank you.
Have a wonderful
Thank
day.
you.
Thank you. Jim, Boothby? Boothby, thanks.
Good morning, everybody. Thank you for the opportunity to address and provide testimony to the council. I am Jim Boothby, a recently retired and I sometimes jokingly say recovering superintendent of schools. I currently am the executive director of the Penobscot River Educational Service Center, and I am in my 34th year of working in public education. In those 34 years, I've had the pleasure of being teacher, coach, middle school assistant principal, elementary principal, high school principal, bus driver, and for 18 years, superintendent of schools. As a superintendent of RSU 25, I had the pleasure and opportunity to work with the Bar Center to implement the bar program at Bucksport High School in 2010. Bucksport High School was the first school in Maine and the third school in the country to adopt the bar program. Why did we adopt the program? Well, when I came in there, we had low graduation rates, higher than average dropout rates, and poor attendance in the school. After implementing the bar program, we saw those data points make significant changes for the better. For example, our graduation rate went from 78% to more than 92% and has been maintained since the program was initiated. We continue to perform above the state and national levels for both graduation rates and dropout rates. The difference, the bar model. What changed to bring about those improvements? Well, it's a conscious effort to establish positive relations with every student, have students be discussed every day, every week, and data collected for each of the students in the 9th grade. We started off as a pilot program for 9th grade. That program has now expanded into the rest of the high school, and we have it in place for the middle school as well. The key to the program is connecting students and families with the internal and external resources to support their needs. Simply put, the bar program provided a realignment of our existing resources and a focus on the individual students and their needs, both inside and outside of the classroom. Thanks to the Maine Department of Education for the use of the federal funds that would have been available, has allowed the bar model to be introduced to approximately 100 of Maine's 569 schools. The vision of the Maine Department of Education to use federal funding to support the introduction of the bar model and to manage schools' registration and funding, provide equity in a streamlined process. Unfortunately, with the end of the federal funding and with less than 20% of Maine schools using the bar model, there remains a tremendous opportunity to positively impact students across the state. In reviewing the Recovery Council's ad hoc committee's funding recommendations, there are a number of places where the bar model aligns with those recommendations. First one, addressing risk and protective factors. The bar model is rooted in prevention science, emphasizing the reduction of risk factors and the enhancement of positive factors in students' lives. This directly supports the committee's focus on prevention and early intervention strategies. Data-driven approach. Committee reports highlights for the need for more data, especially in communities with high stigma. The bar model's use of real-time data is a powerful tool for identifying at-risk students before problems escalate. Schools participating in bar use cohort meetings and other data-driven strategies to track students' academic and non-academic progress, ensuring that any signs of distress, for example, substance abuse, mental health struggles, are identified early. And this protective approach allows for timely interventions and connections with other resources within the community. Building relations and supportive environments. The bar's emphasis on building intentional relationships between students, teachers, and families support the committee's goals of fostering healthier communities and reducing substance use. The models focus on social emotional learning, for example, through U time and I time, which is part of the program, help students develop life skills and resilience. In turn, students become more equipped to handle challenges like abuse and other adverse conditions, which may reduce their likelihood of turning to substances as a coping mechanism. Promoting positive school and community engagement. Our strategies for engaging families in the broader community, such as community connection meetings, align with the committee's goal of increasing resources and creating supportive environments. Engaged families and communities provide protective factors that mitigate the risk of substance use. When students feel supported both at home and in school, they will be more likely to thrive academically and personally, reducing the likelihood of negative outcomes, such as substance abuse. Targeting schools as prevention hubs. With the Department of Education currently supporting 96 schools trained to implement the BAR model, there's a valuable opportunity to integrate substance use prevention sources directly within the school system. As the DOE funding for BAR is phasing out, it's crucial to find alternative funding streams to maintain and expand this model. By embedding substance use prevention within the BAR framework, schools can become key hubs for intervention, addressing not only academic challenges, but also the social emotional factors that contribute to substance abuse. Ongoing professional development. BAR's provision of ongoing professional development for teachers and administrators can help ensure educators are equipped with the tools to recognize early warning signs of substance use and other harmful behaviors. Teachers trained in the BAR model can serve as frontline responders, helping to identify at-risk students and providing them with appropriate resources and referrals. And 7, fostering resilience and life skills. BAR empowers students to imagine a sustainable, choice-filled life. By focusing on students' strengths and providing opportunities to practice essential life skills, the model cultivates resilience. This can play a critical role in preventing substance use by ensuring students feel capable of navigating challenges and making positive decisions for their future. In conclusion, the BAR model offers a comprehensive framework that can complement and enhance the Maine Recovery Council's Prevention Ad Hoc Committee's recommendations. By integrating data, building relationships, offering targeted interventions, BAR supports prevention and early intervention strategies that foster healthier, more resilient communities. Ensuring continued support for BAR in schools can help mitigate substance use risk, particularly in communities where stigma is high, and provide a proactive, holistic approach to addressing and identifying the causes of substance abuse. Happy to answer any questions you may have.
I applaud you for your work and again, the prevention, as you've read evidently our strategic plan in regard to prevention and laid out very well for us how this program meets the goals of our prevention work. And I hope that you note that within, can't say timeframe, but the prevention grant dollars will be, that grant will go out soon. And there'll be conversations with the council as to how that process looks. Again, we delivered the prevention out of that round because we wanted to be able to make sure with a comprehensive approach. So I hope that you continue to watch the work that we do. And it's a much needed support in school systems for programs like this. And I appreciate that. Oh, can I do the question?
Just trying to understand a little more about how you talked about the DOE funding going away. Was that federal funds, pass-through funds
Yes.
situation? Yeah.
All part of the ARP funding.
Okay.
Yeah. And in 2011, I went to the then Commissioner of Education to explain and introduce this model because of its effectiveness. It had been basically, that's not a priority for us until the current administration. They've understood the impact of this. And it's not just about academic performance. Academic performance is an outcome of the whole child. And people have stated it very eloquently before me. there's such a need out there. And being in this business for so long, I've seen the opioid crisis manifest. And what we're dealing with on a day-to-day basis as an outcome of that in the schools has really taxed the ability of us to provide quality educational programming. We found that the bar model did far more than just academics. It really helped the whole child. And there's a process where you have the weekly review by the teachers. And then students that are doing well, that's just fine. They're doing great. Thank you very much. We'll continue to work with them. But then we identify students that have challenges. What those challenges may be could be a multitude of some. But we also have another level, it's called risk review. You take those students that we're seeing social emotional challenges with disconnects or academic performances, which is typically one of your telltale signs of something that's gone amok. And we can determine what can we do in the schools and what can we do to connect with the outside agencies. So it's truly wraparound, and connecting with outside agencies is critical. And I hear people talking about rural support. RSU 25 is a federally identified rural community, and we're seeing it. And we've created relationships with a local regional health center for counseling, but you can never get enough counseling. The need is out there. It's significant across the state.
I'm by no means the expert on new bread, but it's also a culture change within your building, which is
Very
a
much.
much needed piece that the upfront funding is expensive to train everybody.
Yep.
But then that is that culture change in how we see things, almost like trauma-informed treatment. And when you become a trauma-informed treatment agency, it's not just about the children in the building, but it's also about your staff. It's also about a whole piece. It's a culture change, which again, that change leads to real significant change within the community. It's not just a one person, but it's lifelong. So thank you very much.
Yeah.
Any other questions?
Can I just ask a question, Pat? Sitting there thinking whether I'm going to ask this or not. Can you just speak a little bit about keeping up with staff training and the turnover and the culture that you mentioned, Pat? I think it's Herculean, to sort of keep that up and the cost of that. But can you talk about what that looks like?
I can, at least I can from my experience.
Well, you have a lot of experience in your many hats. So.
Okay. So yes, turnover is critical. I can tell you that we're blessed at our high school since we've been doing this. 4 of the 5 teachers are the same ones that have been. That's great. Part of that helps with the retention of teachers because of the culture of the community, culture of the school. And it also helps teachers not feel frustrated. I was trained in students assistance teams a couple of decades ago, and which is a great process, except for we always felt frustrated because we could never get to those kids that needed. We couldn't get to all kids. We were dealing with just a handful. And this process helps us get to everybody. So to keep the training going, once it becomes part of your culture, we actually hire people, and this is part of our interview. And we talk to them about participating on teams, being a good team player. And then we train within, keep going. So we have veteran people. So we haven't relied on or had to go back out and hire the bar center to do training. We actually do train the trainer and build it up from there. So
That's thank you.
I'm still learning about bar and what information we've seen so far at the council. Can you talk just briefly about the holistic approach, the whole school, changing the environment? Where does it connect with the family?
it connects with the family because, so I'm going to, give you an example. So we would have 4 teachers on a team. Okay, say we have 100 students. Okay, so each of those teachers are going to be connected to 25 students, not necessarily by homeroom or any other designation, but you're going to be dealing with at least a quarter of those students. And it's their job to report out to the families on a regular basis, phone calls, whatever works for the family, of how their student is doing, even if it's positive news. God forbid we should call and say, hey, Todd, your son's been wonderful. Things are going great. Just wanted to give you an update. But if we have students that were having challenges, they're exhibiting behaviors, we're communicating with the families. And we're working with them and attempting to create allies. So we can work together. Again, not to assign blame or stigma or punishment. It's about, okay, we've got a kiddo that's in serious challenges here, possibly in crisis. What can we do to support? We can take care of the educational piece, but now we got to connect them with some outside resources, family resources and such. So that's the connection. The other part that we were fortunate with in the Bucksport is we have Healthy Bay Communities, which is not one of the funded 9 regional support systems, where we work as a community. And as superintendent, I sat on their board, and we would talk about what's happening in the community and how can the community respond to the situation. So there are multiple ways it ties to the community.
Thank you.
You're welcome. Thank you for the opportunity.
Again, I'll remind people, if you just came in, if you want to comment, please sign up at the back.
Good morning. Returning and new members of the Maine Recovery Council. I am Megan Hannon, Executive Director of Maine Community Action Partnership, or MECAP, the membership organization for the 10 Community Action Associations agencies in Maine. I will stick to my 3 minutes right now, but I did send your staff a fuller version of this outline so that you will have it. Our state's greatest resources are people, and the policies and funding decisions we make today shape the possibilities for generations to come. At Maine's community action agencies, we are committed to creating conditions where children can learn, adults can thrive, and communities can unlock their potential. One of the most transformative strategies we use is the whole family or 2-generation approach. This model focuses intentionally and simultaneously on children and the adults in their lives, recognizing that what benefits one strengthens the other. It's a proven framework that fosters sustainable solutions, engages community partnerships, and promotes inclusive, collaborative cultures that prioritize the health and well-being of children, youth, and families. Our work also addresses some of Maine's most pressing challenges, including the opioid crisis. MECAP's family-centered coaches collaborate across programs and agencies to support families impacted by opioid use disorder or living in highly affected communities. These teams understand that the root causes of addiction, such as adverse childhood events or ACEs, family history, and mental health challenges, require resilience-building strategies rooted in trauma-informed care, positive childhood experiences or PCEs, and economic stability. Through our whole family approach, families gain access to behavioral health supports, substance prevention programs, early childhood education, and restorative practices. These integrated services prevent ACEs, promote PCEs, and reduce the likelihood of substance use disorder, child abuse, child abuse or misuse, and other risk factors. Since 2022, we've expanded these models to serve over 25 families across Maine. The results speak volumes. 69% of families achieve goals in 2 or more areas of the Thrive to Survive or Crisis to Survival model, and 75% reported feeling supported and connected, critical protective factors for resilience. As we move forward, MECAP is ready to partner with the Recovery Council and other organizations to deepen prevention efforts, strengthen recovery strategies, and ensure Maine's families and communities remain healthy, supportive places where children can grow into resilient adults. Investing in this proven strategy, making it available to more Maine families and support more Maine community-based organizations is a good way to use the opioid settlement funds. I know your own prevention committee recommends it, and it is also a harm reduction and sobriety support intervention. Thank you for your time. I'm happy to take any questions that you have.
I'm wondering about, obviously the prevention work group identified it as not only a strategy, a priority strategy to do more two-generational programming, but also as a gap. And I'm curious about, I know there had been in the past, there'd been kind of more 2-generational programming happening, and then there was like a real cutting of lots of programs. And I see that there are some now, perhaps there are funding improvements. I'm curious about, from your perspective, working with so many CAP agencies, about how, where are you seeing gaps kind of in funding and in services, and kind of what extent do you see as kind of gaps for continuing this really important work?
All 10 of ours do this work. There are plenty of other models. Bangor has a good model. Down East has a good model. There are some in Portland beyond ours as well. The funding is tricky for a couple of reasons. One, it usually requires braiding and blending of different funding pieces, and some funders don't like that. Some auditors don't like that. But it's the way that we can do the work that we need to do by bringing several funding pieces together. Right now, the state is funding our agencies plus one other ECBO in Lewiston to do this through TANF funds. So it's got some rules around it that a regular whole family approach would not have on it. That's another thing that can be a tricky spot. Right now, we're working really well with the folks at the state to make sure that they understand that, yes, this is TANF dollars, and yes, we are, helping to do all the things that TANF requires us to do, but more as well. So it's a tricky sort of thing. Right now, the John T. Gorman Foundation is doing a bit of a, I don't think it's a formal evaluation, but kind of a less formal evaluation of how things are going in different areas around the state. So I'm not sure when that information will be ready, but I think soon that would be helpful.
Actually, this council would have the opportunity to have John T. Gorman come and share with us some of their experience in funding these programs and how some of their lessons learned in doing that. So they would be more than willing to come. At some point, we can have this conversation in the future, but they would be more than willing to share their experience, which I think would be really helpful for us as we figure out how we might put out some of that funding for that priority area. Excellent.
They do have several things on their website too, if you just feel like checking that out.
And thank you so much for all the support you do for all that work, because that work is really difficult. And the grading is, grading funding is really complicated. It's great when people give you the funding to do the whole program, and really complicated when you have to try to meet all these different deliverables to do the program you know is important and works. So I appreciate all that you do to support the CAPS to be able to do that. Thank you.
The stranger to the council, Courtney, Gary Allen. Welcome back, Courtney.
In a new role. Hi, everybody. As Pat mentioned, so I'm hoping I can get a little bit of grace because I'm about to try to unpack 2 years serving on the Maine Recovery Council in 3 minutes. So I'm going to do that as quickly as I can. I do have written comments. I'll provide them to you via email because I wrote them this morning and want to do a couple more edits before I send them out. So my name is Courtney Gary Allen. I am the executive director of MERAP. We're a grassroots organization of people across Maine working on community and public policy-based solutions to substance use. Just want to start off by expressing my gratitude on behalf of my team and my community for your commitment to fund the Access Center, which will be a one-of-a-kind community center here in Augusta, grounded in harm reduction principles, serving some of our most marginalized folks who use drugs, as well as unhoused individuals. The center will operate 5 days a week and have lots of wraparound services for whatever folks want in the moment, whether that's access to housing, healthcare, or something else, as well as recovery meeting and harm reduction services. We are excited to get going as soon as you write us that check. So if you would like to get those contracts done, that would be very helpful because our folks are outside right now waiting for us to open those doors. And on that note, I'm going to dive into some of my feedback for the Maine Recovery Council. First off, a guiding principle. Please, as you go into your terms, remember that this money is blood money. This money is money that is being provided to the state of Maine from companies like Purdue Pharma for the actions that they did, marketing tactics that killed thousands of Mainers here in Maine and thousands more across the country. This is our one opportunity to attempt to make this right via reparations of money. So every time you take a vote, and this is how I served on the Maine Recovery Council, I attempted to remind myself of that. The gravity is real and the responsibility is great. So thank you for doing it. On that note, please continue to center the lived experience of people who use drugs, who are in recovery, and our family members. We are the ones who have been most deeply impacted by the actions of Purdue Pharma and others, and this council has done a great job in centering them. Please continue to do that as you move forward into your terms. Next up, public transparency. Although efforts have been made to make this council as accessible as possible, it's still not accessible, unfortunately. One example of that is right now there are people on Zoom who would like to provide public testimony. I'm not sure if they're still on there, but they can't because you guys are not accepting public testimony via Zoom today. They are unable to be here because they are working or they don't have cars or they're folks who use drugs. So standing before you is dangerous for them. So they would like to be able to provide public comment at places like this. But they can't. So that's one way that you could continue to make this more accessible for our community members. Access to your public email address. I literally can't remember what it's called, but it's council at something where the public can provide emails to you. I had attempted to make sure that that email was automatically forwarded to each individual council member. That never happened for various reasons. I don't know why. And I would appreciate if one of you take up the charge as I leave to make sure that you are receiving every single council email that comes to that email address, preferably in an automatic forwarding way, because we want to be able to reach all of you without having to individually CC you, which is very confusing for most people. Moving on, public comment. This yearly public hearing is great, it's wonderful, and also not enough. So please do more. You are one of 14 in the state, in the entire country, who does not allow public comment at your meetings, at each individual meeting. I would ask that the governance committee take that up. Was another thing I was attempting to finish, but have to go to law school, so headed to law school. So please continue to make sure that conversation is happening. We should be able to provide public comment to you at each individual meeting, like almost every other council across the country. I'm almost done, I swear. Funding. Oh, so the pending applications, there are so many wonderful pending applications that didn't get funded in the last round. Please continue to look at those, like the Recovery High School that you just heard about. It's a great project. You probably don't need another application process for a little while. Save yourself the problems and don't do it. Just look at the ones that, except for the prevention, that's different. Just look at the ones that are pending. If you do another grant application, which is very hard, please don't do a two-step process. The letter of intent and the application was excessive. You could do one or the other or blend them together to make them into one thing. There's things that you could change about each of them, but blending them into one process would save you all a bunch of time, but also us on the outside a bunch of time to be able to get those grant applications done. For the grant application in the system, it was the most complicated grant application I have ever done in my professional career. And that is unfortunate because I know that wasn't the intention of the council, and there's lots of reasons that happened. If you do another grant application, you have an opportunity to change that process. Please do. Get a different grant system, literally the thing that we put the grants into. Please get a different one. It was impossible. And then simplify your grant application. More like the letter of intent. The letter of intent was wonderful. And there could have been just a couple of things that were different or added to, like a budget. There are multiple organizations that didn't submit applications, even though they got through the letter of intent, because either one or two, I'm almost done, I swear. One or two, they couldn't figure out the whole thing. Or two, they did submit grant applications and it took them like 50 hours to write the thing. I mean, it took me forever, and I have a master's degree and 2 grant application classes under my belt. So they either didn't submit even though they got through because they couldn't figure it out, or 2, they spent so much time when they should have been out with our folks doing the work, and then they didn't even get funded. So just please, for love, all things holy, simplify that process. Next up, couple last things. Moving from looking back, now I'm looking forward. So looking forward, you need more staff. Like, love Mary right to death. She is amazing. And also, there is no way she can get all this work done without more help. So there has been extensive conversations about hiring an executive director. You should do that. Put the application out, stop talking about it, just do it and get her some help, as well as maybe some support staff, whatever that looks like. I'm not like super concerned about what it looks like, but please get Mary more help. For leadership, as you continue to look towards your next leadership elections in January, I encourage you to consider ensuring that there are multiple people available on your ballots. I know it's not like a technical ballot, but I urge new voices on the council to step up and step into leadership and continue to help build this council as you move forward, helping to make sure that there's more transparency and urging new voices to step up. Last two, swear. Act swiftly. The council has taken a lot of time. The last 2 years, it was a very intentional process. I was part of being one of the leading voices of making sure that it was an intentional process, and that was the right thing to do for the last 2 years. I stand on that ground. And also, your decisions have been made to some extent. Now it's time to act and get that money out the door. There are projects that are waiting, such as ours and many projects across the state that could open very quickly. So now is the time to act swiftly and decisively to get those contracts out. Finally, and last but not least, is finalize those contracts. I believe the council has contracted with Barry Dunn, and they're phenomenal. If you don't know who they are, they can help you get all of that legal stuff done and the paperwork done. And now is the time to act. That was a lot. Thanks. I'm Courtney. Happy to take questions.
Courtney, ever since I met you 2 years ago, you've put me in uncomfortable positions and made me look at things that I didn't want to look at. So thank you very much for that. And I hope you will continue to do that as a member of the public and commenting on the Recovery Council.
Thank you, Paul.
And Courtney, you're going to send that to us in writing? I tried to write down, but you cover a lot.
Yeah, I've got, I
Okay.
just want to, yes.
Thank you.
I'll make sure.
I just want to publicly thank you so much for all that you have done and been for this council. I think your vision for what we should be doing here and how we should do it and your leadership have been incredible over these 2 years, the last 2 years, and you will definitely be missed. And so we all will have to step up to really, I think there'll be a like, what would Courtney say kind of thing happening for us internally of how can we continue to challenge? Because I think there are ways in which there are things we feel confident in doing, and there are ways we should continue to challenge each other to think differently about how we do them. So I'm just like so appreciative for all that you've been.
Thank you, Liz. I really appreciate that. And please know, as a council, my phone is always open. I'm happy to take your phone calls as you think through these really difficult problems. And also at the end of the day, if you're ever wondering what Courtney would say, it's people who use drugs don't deserve to die. And we need to act in a thoughtful and calculated way. And you can call me anytime and I'll talk you through that. And it's okay. Like, it's going to be okay. We can challenge the systems and we can fight back because that's what our folks need. And I hope as I pass the torch to all of you, that you each individually will take up one part of that work.
I just want to say to both of what you guys said, we're going to see her all the time and she's going to be even louder because now she's on the other side. So
it is much easier to be, I mean, roles are important, right? So I serve an important role in the grand scheme of the advocacy movement, which is to call our community to action. And that is a little easier when you're not sitting on that side of the bench.
Courtney, thank you so much for your service and your leadership on this. I heard in your testimony a lot of the barriers folks have in sharing what they need. And I know you and I'm sure many on this council trust people to know what they need to heal. So in your opinion, what are ways that we can explore making sure that more people have an opportunity to share how the opioid epidemic has impacted themselves and their families, and more importantly, what will help them heal and get through it.
Yeah, so I mean, I think the Maine Recovery Council, again, we all play a special role in the grand scheme of this, right? So the Maine Recovery Council's primary job is to get the money of the opiate settlement suits out to the community in a way that is equitable and thoughtful and accessible. So I would ask that you all really focus on your part of the work, right? To make sure that those emails are coming to you, so we have access to you when we want to get to you, to make sure that you're accepting public comments at the meetings, and decreasing these barriers around how to get access to these funding sources. And I don't know if that answered your question, Tess. Spiraled there.
Thank you.
I also just want to say on record, leaving something that you care about so much is a hard thing to do when the work doesn't feel done. And it's something that I'm intentionally doing as I step back and make choices about my future and my career. And also really grateful to the Attorney General for appointing Tess Parks in my place. She will help remind you of what Courtney would say. Very proud to have you serving. Thank you, Tess.
Thank you for everything that you do for the people of state of Maine, and particularly for the council. It has certainly been a pleasure. And we all know that your voice will continue, because that's what you do best. And we're going to count on it to keep us on our toes. And so I thank you for that. And I do know this was a hard decision for you, but you're doing it for the greater good. You need to go to law school, so, and your family. So it is greatly appreciated. And we thank you for your comments today. And again, please put them in writing so we can have them.
Yes. Thank you all so much.
All right, a reminder here before I call the next one. The next one is Kelly Cookson. And I just want to remind people, if you do speak, to sign up the sheet. And the second piece is my little notes here. Second piece is that if you do have written testimonies, make sure that you use a copy of that, so that they have that, so they can scan it and put it on record, not just give it to the council members, but have that testimony back. And if you don't have it with you, if you would email it to us at our email address, we'll make sure it becomes part of our record. And welcome, Kelly.
Thank you. I'm not excited to follow Courtney, but thank you for allowing us to come and to speak today. Welcome to the new members. And okay. Oh, first of all, I apologize I do not have copies of my written testimony. There were some connectivity issues, but it has been emailed, so hopefully you'll all receive a copy of that. My name is Kelly Cookson. I'm the director of Save a Life in Lincoln. I'm also a person who was overprescribed opiates in the 2000s due to the misinformation the pharmaceutical companies spread and were sued over, which is why we're here. The mother of a daughter whose heroin addiction began in medicine cabinets, so this is very personal. We're not unique, as women are more likely to be prescribed and to use prescription opioids. Not only are women more likely to use prescription opioids, but patients in rural counties had an 87% higher chance of receiving an opioid prescription compared to large central metropolitan counties, as stated by a study in the done by the CDC, which is included in the testimony that's been emailed to you. So this means the women in my community and their children have been the most impacted. And I have one of them with me today who'll be speaking after me. I'm here today because we're facing a crisis. Our accessibility to a grant writer is very limited and used very sparingly because we are a very non-profitable nonprofit, like many. With that being said, we did choose to utilize her for the RFP, which has since been pulled and lost thousands of dollars. And we also utilized her for this extensive grant, which we have not been funded for. Our scoring results of our submission raised some concerns about the fairness and equity of the evaluation process that Courtney's already kind of gone into. For us specifically, the significant variance in the scores led us to question the vetting of volunteer scorers and the impact that one person's opinion could have on our organization's entire future. Our rural communities come to depend on Save a Life for essential resources. Without proper funding and staffing, everything we do is at risk, along with the well-being and lives of those we serve, and frankly, the well-being of the people that are doing the serving. Penobscot County has been deeply impacted by overdoses and is currently grappling with an HIV outbreak in Bangor, which is a lot of our folks are back and forth, and frankly, it's a matter of time before it's in our community as well. We're the only recovery community center in our area that are providing harm reduction in this region, and we're filling a critical gap, including rapid HIV and Hep C testing that will be beginning, I'm hoping as early as next week or the following. People are traveling up to an hour to access our supply services, education, but most importantly, the human connection. You can get things in the mail, but that is not the same. Our small grassroots organization has been stepping up to address the urgent needs of our community. And this was not by choice. This was because we took the time and we listened. And we've been tackling 3 of the 4 pillars identified by the council: recovery support, harm reduction, and prevention. And prevention includes adults also. Please remember that. While our main focus has always been recovery support, the ongoing crisis has forced us to expand our services. But we are overwhelmed in every possible way. It was especially concerning to me when I was looking over the scores and I saw that our next closest community center, which would be peer-to-peer, was by far at the very bottom of the list. And to me, that immediately struck me as, what are we going to do if they're not available? There will be nothing. Our local businesses, we're not in a position to continue to offer these services while also constantly chasing funding. Our local businesses are few and they're tired and they're tapped. I'm sorry, I'm kind of going off lib here and confusing myself. We don't have the money, like I stated, to continue hiring a grant writer. This funding is about helping people that have been affected by substance use. It's about supporting healthier communities. It's about helping those who have been overlooked. And Save a Life has continuously been overlooked. So please give us the opportunity to continue to keep helping our community. I'm asking for a second set of eyes, an appeal process, anything along those lines would be extremely not only helpful, but probably vital. And I'm happy to take any questions.
No, there is not an appeal process.
I was not aware of that.
So there isn't an appeal process, but, and again, please, council members, speak up. We haven't determined what's going to happen to the part of the unfunded programs that are there in the school. And so what we, and I think you've heard Courtney eloquent when we talk about it, that is the goal of us, is that not to go necessarily out to grant process again when we have, if we discover that we had some additional funding, is to look at the applications that we had before us, that particularly those who scored well and what those comments were. And so one of the difficult pieces, and which Ben was here to explain it better than me, our treasurer, but we're constantly looking at how much money do we have and how that is. And so right now, we know that we think we've spent a certain amount of money that we have, but we don't know if there's some surplus here. I shouldn't call it surplus. I should call it money that's there. And we don't want it to sit in the bank. We're not saving for the rainy day because it's already raining.
Yes.
And so one of the things that we intend to do as a council is, we know that we have definitely allocated to certain ones, but we know that we have some applications like yours that were really, deserve a second look, that deserve, again, we know the work of peer recovery centers and how important it is. So, I don't want to, I can't give any promises, but I don't want to also, I want you to know that door is not closed. That we will look again, we just have to look at how much money did we just spend? How much did we promise? What's coming in? There's interest on the money and a lot of interest on a lot of money.
And again, our intent isn't to save for a rainy day. Our intent is to get that money where it needs to be, in order to save lives. And so I would encourage you to keep listening, to keep moving forward. And again, as we look at what do we have for funds? What did we promise? And we do have the prevention grant dollars that we promised that out to, so we have to keep that in mind. We will again be reviewing some of those, and I thank you for your comments today. Those are very helpful, and as we make this decision. I know, because I live in Penobscot County, I live in Bedford, but I know members of your board, and I know what a wonderful job you're doing. I know that as a person, not necessarily as a member of the full council, but so I hope you keep continuing your work, and I know how difficult funding can be. But again, the door is not closed yet, but I can't make any promises.
I understand that. I will point out that one process issue we're having also is, because I am so personally tapped out, I didn't have an opportunity to put eyes on our application before it was sent, and someone had the assumption that they would be able to print that, and so I haven't even been able to put eyes on it. So that's just another issue that I wanted to point out.
Conversation, Mary.
No.
Okay, I would encourage you, very point about that, to make an appointment with Mary on the phone or Zoom meeting.
Okay.
To really go over your application, to look at it and to see what comments were there. And that could be very helpful to everyone involved.
Thank you.
But again, and Mary in that process can highlight maybe some, share with you some of the comments that were made that will help you in either with this or with future grant writing or however that works. But we're try to be a real open book. And Mary has been able to talk with people about the comments that the evaluators made and the chance for you to be able to be heard. So please, Mary's right up back and please make an appointment.
I will
speak with
absolutely
Mary
do that.
and
Yeah.
do that. And your work's important. It is valued. I hope you know that.
Thank you. We're gonna keep fighting.
Keep it up. Oh, Stephanie?
Oh,
Sorry, Kelly. I just had a question.
Yeah.
When you mentioned peer-to-peer and worried about theirs in case something happens to you
Yeah.
guys, how detrimental is it right now? Like if there was a timeline where you guys might not be able to operate because of funding, like are we at that point to worry about?
I think we're at that point. The capacity point is just about reached, if not been reached. And I'm really concerned that we are coming into a time where we will need to start turning people away. Does that answer your question?
Yeah, thank you.
Thanks,
If
Jess.
you are, and not to diminish that you don't need more money, but you are on the able to receive funds from the bill that was in the last legislature, right?
I don't know that we've gotten any updates on that.
So that don't they get that in the next funding cycle?
Yeah, the funding will be available July 1st, 2025. Kelly, is that ahead of schedule for where you think you might be closing? Is the need imminent before then?
Yeah, I mean, we're pinching pennies. We're at that point.
How much was your application?
I please don't quote me on this because someone else, I would guess around 5,000 is what we pay. Oh, well, how much do we apply for?
Yeah.
I think it was 500.
Okay.
500,000.
It might have been, I don't know. I'm sorry. I'm on the spot. I don't.
We can look it up. Yeah.
Mary has it.
Don't ask me numbers.
But again, yeah.
All right.
Meet with Mary, please meet with Mary, and if you have any questions or concerns, let us know.
Thank you very much. As a member of the healthcare community that contributed to this problem, I apologize.
You were
Relates that-
misinformed as well.
But you, Courtney, several other speakers today have told us several things. One is never forget how we got here. And our job is to get this money out. We should not be saving it. The first council, the first term, we talked a lot about not wanting to tie the hands of the next term. with obligations for continued funding. Now we're at the second term. And I think we need to be liberal about getting as much money out as we possibly can.
I agree. Thank you.
I can answer my own question. It was 240,000.
Oh, okay. Thank you.
Yeah. Hi. Sorry if my voice is scratchy. I was sick the other day. So, my name is Bella and I go to Save Life Recovery Center. I'm a part of the teen council and my family has sadly suffered with a lot of drug abuse. Growing up, I was supposed to be the perfect child and I always had the perfect life, apparently to everybody, but I never had my dad around. He and my mom got divorced because he was getting abusive and was an alcoholic and was abusing drugs really badly, and it was getting unsafe for us to be at home. I grew up with my grandparents and my mom, but my mom was always at work, so I didn't really have her around. It was just me and my brother. Then my mom has had a lot of boyfriends, but we don't talk about that. But anyway, she got married to this guy who is technically my father. I call him my father because he's more of a dad than my actual dad was. And his name was Nathan. They had my little sister, but he also abused drugs. But he was like, I don't know how to describe it. He was safe. He knew not to put us around it. So, but we found out that he had cancer and it was too late. And he ended up going to the hospital and I was too scared to go into the hospital, go see him because I was so afraid because he was hooked up to a whole bunch of tubes. And he ended up dying of cancer in, I think, 2018. And it was really hard on my family. It was hard on my mom. My mom could not handle it. So she started drinking more and she started abusing drugs. Then me and my brother and my little sister, we ended up moving in with my grandmother. And my mom ended up moving in after my dad passed away because we couldn't afford the house anymore. Then my mom got a new boyfriend and he ended up being a drug addict and he was selling drugs. And my mom became a drug addict too, sadly. And the night that she got caught with my grandmother went through her room and me and my little sister were in the living room. And she was only like 6 at the time. And my mom got home and my grandmother started screaming at her in the living room and smacked her across the face in front of my baby sister, which was a lot for me because I basically raised my little sister and she's basically my kid. But it was very hard on me and I couldn't handle it and I wanted to kill myself. I was very alone during that situation because my brother completely shut off. He wouldn't talk to any of us anymore, which was really hard. But I ended up moving with my aunt and uncle. My little sister is staying with my grandparents, but they are living in Lincoln with me and with everybody. But I still felt really alone because I didn't have my mom anymore. And I haven't seen my mom in a very long time now. I still talk to her, but I haven't seen her in a very long time. But I started smoking and drinking at 14 after 8th grade because it made me feel calm. Like the thoughts weren't in my head anymore. And I was finally at peace in my head, which is really lonely because you have nobody after that because nobody wants to be around you anymore, which is really hard. Then just in this September, I got caught smoking at school and I got pulled out of school by my aunt and everything has been taken away from me. I don't have a phone. I'm not allowed to talk to any of my friends. I'm not allowed to leave the house unless I'm supervised because I'm not trusted anymore, which is really hard because when this all for like everything first happened, when I first got in trouble, I wasn't allowed to do anything. I felt so alone and I was scared all the time and I just wanted to die. Like I genuinely did not want to be alive anymore. And it got so bad to the point where my uncle had to take all the guns out of the house because I was ready to die. I was gonna kill myself because I couldn't handle it. But before all this happened, I started going to Save a Life. And it has helped me so much. I used to be a very quiet person and now I'm very loud and I like being loud. I'm very talkative, but it got me to open up about everything. I'm allowed to talk about my feelings and stuff like that, which is amazing. I met so many new people and they're so nice and kind to me. And honestly, if it wasn't there, I don't know where I'd be right now. Probably still smoking and drinking, which is not good, but it's very Save Life has helped me a lot and I love there. I'm a part of the teen advisory council and I get to lead a whole bunch of stuff. Right now we're leading craft fair, which is tomorrow and on Saturday, which is awesome. And I'm very excited. And there's gonna be a hot cocoa bar, which is the best part. But yeah, that's it. Thank you. You can try. Thank you.
Can I ask you a question?
Yes.
What do you need to keep becoming yourself and keep progressing?
Probably the people around me. It's like a lot of help. I need positive people around me, or I'll just, because a while ago, I had very negative people around me, and that's how I ended up smoking and stuff like that. So just positive people, people that like know how to make me happy. I need to be able to like go somewhere where I can be alone, so I can like think to myself.
Thank you.
You're welcome.
I don't have a question. I just wanted to tell you, you are so brave. I could not imagine being your age and coming up here to speak like that. Like, you did a wonderful job.
Thank you
Thank
so
you for
much.
coming to us today.
Thank you. Thank you so much.
And it's a craft fair tomorrow.
Oh yeah, and Saturday. Be there.
Field trip to Lincoln.
Everybody, and where exactly is that craft fair?
19 VFW Street in Lincoln. It's from 3 to 5:30. Bring your wallet.
Save a Life Recovery Center.
Oh.
Save a life.
Thank you. Thank you for.
Thank you.
Keep that voice. Thank you. Looks like Addie. What is that?
Govinda Das.
Fifty?
Govinda Das.
Okay.
Adi Govinda Das.
Thank you.
Yes, thank you for having me. My name is Adi Govinda Das. I'm the president and founder of a local nonprofit here in Maine. We provide holistic health consultations and education on natural living, sustainable living, natural healing, and spiritual transformation work. We've been a nonprofit for about 9 years now, and I'm here to share a little bit about my opinions on some innovative approaches to helping with this crisis we're all dealing with. And I'm happy to hear that there's a new emphasis on prevention happening within the council. A lot of my work as a holistic health care provider is based upon prevention. My education is in alternative medicine. I have a bachelor's in alternative medicine. I'm a master herbalist, and my master's degree is in Ayurveda. And Ayurveda is the medical system from ancient India. It has thousands of years of evidence-based approaches towards holistic health. And one of the principles of Ayurveda is called Kuti Praveshika Rasayana. And that's a mouthful I won't expect you to try to repeat. But essentially what it translates to is restorative therapy by full immersion in forest settings. And in Maine, we have a large forest, and there's so much access to natural environments. And I think that they could be better utilized for therapy. And so my proposal is to support the funding of retreat centers that are based on this principle of immersion in forest settings. as a method of exposing people to pure environments, taking people out of environments that may have caused their substance use disorder, and bringing them to environments that can be really rejuvenative, really restorative for them. Prevention has, overall in our medical system, has very little emphasis, it seems, from my perspective. Items like stress reduction and nutrition and massage, they are not typically available in our hospital systems. And it's for this reason that I'm begging the council to consider funding these kind of projects, because there are nutritional effects and influences on disease, especially nutritional influences on the tendency for substance use. Ayurveda has options for a wide array of different diseases, and it is a very viable option for people who are struggling for substance use. I've submitted a document to the council that has an essay detailing some of this evidence, particularly with the use of yoga as an adjunct therapy for the treatment of substance use disorder. Yoga is one tool in the chest of Ayurveda, and it has a large body of evidence supporting the use of helping people recover. I myself have worked in yoga systems and practiced yoga systems for the better part of 10 years. And I have recovered from myself from certain use disorders, substance use disorders. I have friends and family who have also taken to the path of yoga. And in those exercises have found a greater sense of self-control, a greater mindfulness over their daily activities, and an inclination towards living a life based on natural wellness and finding sources of happiness that are self-sufficient or generating from the self. I'll also like to say that a retreat center such as the one I'm proposing would be a viable resource for people who are affected others. For every one person that is taken from us from substance use. Sorry, I have several family members who have passed because of this. For every one person that's taken from us from this epidemic, there are 10, 15 people who have been affected. And centers that are based upon providing access to holistic health care can be really supportive for affected others. And I would like to be able to provide that to people. And my nonprofit is in need of funding to do this. Currently, over the last 10 years or so, we've provided personal consultations, and we're looking to expand our services to be able to provide immersive retreats in forest settings for the application of Ayurvedic therapy. We also hope to provide education on holistic healthcare, how people can maintain their sense of well-being and sense of health through natural means, such as through diet or stress reduction, exercises. I also am educated in natural building techniques, which is another great option for people who are suffering from homelessness, which usually go hand in hand with substance use disorder. If people can be educated on how to build their own buildings in an affordable way out of materials that are healthy and easily accessible, such as natural building materials like cob. Cob is an aggregate of clay, sand, straw, and water, and you can put up whole buildings for 1/20th of the cost of a traditional home. And I'd like to be able to provide this kind of education for people who are struggling with homelessness so that they can be empowered to build their own houses, to grow their own food, and utilize systems of natural health care that provide them access to a sense of well-being that does not depend on any substances. I apologize for joking up so much here. I was hoping I'd be a little bit more lighthearted. But in conclusion, I'm just begging you to consider my application as you move forward with this next round and with the emphasis on prevention. And thank you for hearing me. I'm welcome to try to answer any questions there might be.
Yeah, if the governor's opium. I think you submitted some other information to us.
Yeah, a letter of intent.
That as well as you said you sent additional testimony?
I did, I submitted an essay
Okay,
just this
and
morning.
the full council will look at that information.
Thank you.
Question?
Thank you.
Thank you very much for the work that you do, and again, you know that prevention will be, you'll hear when the prevention trends well. Thank you very much for your time. Thank you for waiting so long. Thank you. Nicole Proctor.
Good morning, everyone, and members of the Maine Recovery Council. My name is Nicole Proctor, Program Director at Portland Recovery Community Center and a woman in long-term recovery. PRCC is operated by passionate staff and volunteers with lived experience and offers peer-driven support, activities, and meetings tailored to diverse recovery pathways. Statewide, PRCC supports the growth of new and existing recovery community centers through the Maine Recovery Hub, providing training, resources, excuse me, I'm so sorry, resources and technical assistance to empower the 19 other centers in our state. I am here today presenting on behalf of Leslie Clark, our Executive Director. Thank you for your dedication over the past 2 years, and as you have worked to oversee the appropriate and effective use of opioid settlement funds. And welcome to all of the new members. Your efforts are building a foundation for truly meaningful change here in Maine. This past summer, PRCC visited the recovery community centers across the state of Maine as the Recovery Hub. It became clear that stigma and misunderstanding about substance use disorders, harm reduction, and recovery remain pervasive in every community. These issues exist within local governments, schools, and businesses, and these misconceptions often prevent individuals from seeking the help that they need and hinder recovery-friendly policies and practices. Furthermore, stigma creates barriers to collaborative efforts and opportunities between community organizations. We encourage the council to prioritize funding for effective community education and stigma reduction initiatives, and to utilize the recovery community centers to forward this work. A well-designed media campaign could deliver powerful messaging with information about substance use disorder treatment, prevention, harm reduction, and recovery. Education and training about stigma have far-reaching benefits, and reducing misconceptions leads to stronger partnerships across pillars, agencies, and sectors. Recovery community centers are uniquely positioned to reduce the stigma by bridging local communities to the resources and support. Excuse me. I'm sorry. There are powerful, authentic stories to be shared by the staff, the participants of the centers, which you just heard, and families and volunteers alike by bridging local communities to the resources and supports at each center. We have seen a powerful impact of education about substance use disorder and stigma through Maine's Recovery Friendly Workplace Initiative. However, to sustain this meaningful work and expand their reach, centers must be adequately funded to meet the growing needs of their communities. As you move forward in this work, we also ask the council to be mindful of the schedule of RFPs and reporting requirement required for recovery community centers to apply for funding. Please consider the importance of an organized and planned funding disbursements, a clear and predictable schedule for the council's future proposal opportunities, and it will enable recovery community centers to strategize effectively and better address ongoing gaps in sustainable funding. Thank you for your consideration of these recommendations and for your ongoing commitment to this work. Together, we can all continue to create a future where recovery is not only possible, but understood, celebrated, and met with compassion across the state of Maine. Happy to try to answer any questions that you might have.
Thank you very much for coming up and talking to us. Nicole, are you aware of any good evidence-based methods of reducing stigma in any certain population. For instance, I've been trying for several years to decrease the amount of stigma in my healthcare community. And I haven't found any good studies that show of an evidence-based way to do that.
Well, as the Recovery Hub, we do a lot of the science of addiction, which you are, as a doctor, are very aware of. I think personally, the more that we can get the science of addiction and recovery and how the brain can heal, and how trauma and ACEs, all of that affects the brain and leads us to addictions. So I don't have the answer, but I do believe that, for example, we can have a huge impact in educating first responders and sharing the stories, right? Because first responders see us at our worst and not only get better. And I think that that has a huge effect on stigma.
Because of the lack of really good studies to say this works and this doesn't work, I agree with you that I think just education on the science of addiction, on the efficacy of treatment, is what I've been using.
Yeah, the Recovery Research Institute out of UMass Harvard does amazing studies as of, the last probably like 10 years, 15 years. So there's not enough, but they're continuously doing studies. So hopefully we'll have more evidence soon.
Thank you.
Yes, Liz.
If, so the Maine CDC for the last many years has done campaigns, media campaigns and their version of stigma reduction campaigns. And I think some of the campaigns, in my opinion, have been, okay. Some I actually think have actually caused some more harm than and some have been really great. And so I'm curious about, I think often when those campaigns are informed by either, depending on who the audience is, when they're informed by people in that audience, when they're informed by people with lived experience, when they're informed by prevention experts, the outcomes are usually much better. I'm curious if they have done any outreach, the Maine CDC has done any outreach to you all as kind of the hub for recovery community centers around those campaigns, because it feels like you have an opportunity to be a real part of the supporting, because they actually spend millions of state dollars on those. So I'm curious about that connection.
Absolutely. Thank you for asking. No, the answer is no. They have not reached out. However, there have been participants in some of those from centers around the state. But no, I mean, we have not been involved. And I know that there's a ton of money already spent. I just feel like there must be some, I think back to the egg frying in the frying pan when we were like younger kids and how ineffective that was. And I just feel like, they're talking about the brain back then, frying like an egg. Like, let's talk about the brain healing. Like, I don't know how you make that into a 30-second snippet fun commercial, but like, just, I don't know, some evidence.
Yeah, well, it feels like the options campaign was one in which people with lived experience really had a real voice in that. And that previous campaign, I'm not sure what will happen with the new version. And, as an example, the Eyes Wide Open started as one that I thought was incredibly stigmatizing and actually was causing some harm. I think they changed the messaging, but that one was really not there weren't people who were sharing why that was harmful or why they didn't ask for that from folks. So I think if we can, yes, there may be opportunities for the council to support, some of these efforts, but I also think one of the things we have as a council is a voice to share some of our concerns with how other money is being spent. And that if there are ways in which connections can be made, right? Like you all have this experience and a desire to be a part of stigma reduction. They have funding to do community campaigns. How do we make those connections?
Yeah, thank you.
Nicole, in your next to last paragraph there, can you help me, can you be a little more specific? Either now or later, you asked us to be mindful of schedules for the RFPs, reporting required, for funding, organized and planned funding disbursements, right? You're talking, I'm assuming in the first sentence, you're talking about keeping it simple, which maybe we haven't done a very good job at, to some extent. And then, you're thinking like things like, where I'm going is, I'd be interested in what you're trying to say, right? So,
Yeah.
A schedule where we disperse money once a year, twice a year.
Right.
Spring, fall.
I think,
I don't know. I just, any thoughts you might have would be helpful. You don't have to do it now. I don't mean to put you on the spot if you haven't had a chance to
yeah,
talk about it, but if you could get that to us,
yeah.
I would find that helpful.
Yeah, we absolutely can be really clear, like, just to know that like, hey, recovery pillar can apply every 2 years or every year in the fall or the third quarter, just a predictable schedule for the next 16 years or however many years are left, so that we can plan ahead and know what's out there and available.
Thank you.
Thanks. So PRCC rocks. You guys are amazing.
Thank you.
Say hi to Leslie. Can you just also think about, not to put you on the spot, but to kind of build on what Liz said? You know, I think about kind of longevity and sort of like this, what you describe as a public awareness campaign has to not be for an hour. Like this has to go on. And when I'm in a lot of meetings, when I'm talking to people in DC, and they talk about the effectiveness of the NRA and their simple message and how people, you're into guns, you understand that. But if you could sort of send us some ideas around kind of a campaign over time, I think that would be really helpful for us to sort of, not a lot of work, but just ideas around sort of a stigma reduction campaign for a 5-year window. So I think money gets, maybe the CDC puts out money, but I think maybe we can influence that, the council, around how we stay the course with the campaign. And I know things change, but yet they still stay the same. So any ideas,
Yeah.
we'd love to hear it.
Awesome. If we can compile them, we'll send them your way.
Yeah, thank you.
Well, I jokingly say, because I live in Bangor, I'm connected to the barn. So the biggest piece of Bangor at the barn was trying to break the stigma that who these people were that were coming to the center. And so someone had a brilliant idea that we kept bringing in businesses and whatever. And someone had this brilliant idea of having a chamber event at the barn. And after hours event, I said, well, there's usually drinking. They usually have a bar and it's a thing. And they said, in the barn, I think at this point it existed about 5 years. And we didn't realize the impact until we made this leap and said, all right, let's invite the chamber in. We're going to have an after hours event, but there's no alcohol here. But we're going to have an after hours event. We packed the place. Packed it. Full of business leaders, full of, the city council from Brewer, the city council from Bangor, and all of they were beginning to start taking ownership, or not ownership, or pride, I think is more the word, in that the barn was there in their community, and that people here were part of the community. They weren't some sort of odd stranger. They were, and I was amazed. There was no alcohol, that all of these businesses showed up and became partners to the barn. Again, it took a long time for the barn to infiltrate and say, here we are, ask us questions. We're just like you. We're just like your family members. And again, it's that piece that somehow people who have a substance use disorder are different, and they're not. They're people that have a brain disorder. And as my friend, if I didn't point out, Joe Pickering, didn't make me say, it is the head is attached to the body. And when we start realizing that when you're treating people who have a mental health disorder or a substance use disorder, they are brain disorders, and it's part of the body. And we have to treat it such and give respect to the people who have that. The Portland Recovery Center certainly has been instrumental in showing us that people in recovery have value and worth in our community, which some of us didn't know, and now they do. So I applaud you in your work.
love the fact that all of you guys talk to each other and there's a hub. And I also understand the difficulty in money and what you need to survive. And I hope that I think the council recognizes that. And I hope that we do that, but keep up that work at the recovery center and I hope you, I mean, please give my best to Leslie.
Thank you.
Oh, Jesse.
Comment and a question. In all the talk about stigma and everything, I just want to remind people, it's not just people in recovery, it's people who use drugs, and not everyone who uses drugs has a substance use disorder, and the stigma around all of that needs to be looked at. Otherwise, it's just stigmatizing. So the question, separate from all of that, it goes back to Kelly's testimony. How do you guys support the small rural centers to find that funding so they don't go under?
So before, I mean, there's a limited amount of funding around the state, right? We did, before you guys put out your LOI, and your RFP, try to go in as a team of centers so that we could divide it up amongst the centers that needed it and come to you guys as one community asking for funding. In the end, it was decided not to do that, but we did believe that that was our strongest approach to getting everybody funded that needed money. We didn't get that opportunity. But other than that, and keeping the centers apprised of when the state RFP comes out, other small funding options, it differs from county to county. So
do you guys help support with writing, like with writing the grants? Like how she talked about how they had to pay for a grant writer they can't afford. Is that some technical assistance PRCC could provide to the smaller centers?
well, it would depend. If it was maybe a local grant that they were applying for that, like with your grant or the state RFP, if it's something that we're all going in for, we wouldn't be able to do that. However, if it was a county grant, we could certainly give some support, but we're not professional grant writers either. However, we can certainly review a grant and give, feedback before it's submitted. Yeah. We can also pull data, if they are on the data platform, we can, which not all centers are on yet. But if they are, we can pull data from there if they're entering it and give them some data to use, like their personal data to use, which is always more effective when you have some numbers.
Nicole, do you receive funding from foundations?
We do, yes. Yep.
Great.
Many, yeah. Yep. Thanks, Ed.
John Reynolds. Patiently waiting.
Good to see you back. I'm bringing up Courtney's testimony. She finally got some copies from you guys. So this has nothing to do with what I have to say, but I want to give it to you guys. You guys have a heart. It's good to be back in front of you guys again. Thank you guys so much for having us. Before I get started, I kind of wanted to briefly touch base on a question that both of you guys had, something about stigma, a proven strategy for being effective with stigma is deep canvassing. We found that deep canvassing is a really good way to be able to get face-to-face with the people and talk with them about personal experiences and how it has affected their life and you know, where they are today. This dates all the way back from substance use, all the way back to the early LGBTQ movement in was it California? Yes, and how they were able to change that stigma. So just wanted to touch base on that with your guys' question. So hello, everybody. My name is Jonathan Reynolds, and I'm the organizing director with MERAP. I just want to come here today, first off, to say thank you guys so much for the approval of the allocation of money that we will be receiving soon. I really do appreciate it. It means a lot to not only me, but the people in my community. I feel like it's kind of ironic that this is happening today after an extreme storm we had yesterday, because one of the things that we'll be working on is providing a safe place for people to be, because they're cold, they're wet, and they need connection. Something that that young lady that was brave enough to come out and talk about earlier is she found connection at the place that she was looking for. That's what she was trying to say is I found connection somewhere where she felt whole. She could be herself and find herself. One of the biggest parts is people in the world need connection, right? We need these people that are cold and wet and they don't feel connected at all. They have to live out in this crap that we just all were lucky enough to be sheltered from, and they just need connection as well, so they can experience what that brave young lady just came up here and said. That's one of the things we're aiming to do. We'd love to have the money as soon as possible. Also understand you guys are working hard. Get the money out. Let's save lives. Thank you, guys. You have any questions?
Any questions, John? Con, you can't let him get away with this evening.
Short and sweet. Bye, John.
Hi.
I said bye, but.
Oh, bye. Yes, thank you. Bye.
Thank you, John. Thank you.
Nope.
Keith, Pelletier. Hello, Keith.
For seeing me. Good to be here. I gotta tell you that I don't represent anybody other than myself and my family and people in the state of Maine. And I'm not asking for any money in particular.
Could you pull this up a little bit
Is that good?
better?
Thank
Thank
you.
you.
I came here to speak from experience and what you guys are talking about today. And first, I want to say that, Doc, I think you should be held more accountable than just an apology. There is a county, Aroostook County, full of drug addicts that don't care about your stigma, probably not even aware of what's going on here today. But I can't tell you how much they need your help. Won't ever ask for it. And from what I'm hearing today, probably won't ever get it. I'm sorry that I got to bring this to your attention, but you guys are beating around the bush here. I've witnessed generations of drug addict women teaching their daughters to have children with multiple men because it's more lucrative when they're living from the state of Maine. Aroostook County at one time was regarded as, well, I can somewhat cite Theodore Roosevelt in a paragraph that I read recently where he admitted to being grown up with a silver spoon in his mouth. Didn't really have any guts at all until after he graduated from Harvard or Yale or whatever it was. He made a trip to Aroostook County where he found his intestinal fortitude to go on and do what he did and was remembered for. He got that from Aroostook County. When I was young, I could go anywhere in New England and get a job because I was from Aroostook County. And it's not that way today. Okay, I moved away in different states to get jobs and work, and I went to Minnesota for a little while and come back, and everybody that I knew was on pills, which I directly hold you and yours responsible for. I've got a niece that sells her ass still today, and there is no what do you call it, methadone clinics up there for them to go to, and if there was,
I mean, the miles and miles in between, they have nothing. They're growing up with nothing. They're growing up on the state and have no aspiration other than to do drugs all day, every day. And you guys are sitting here talking about giving money back to the people that got them all hooked on drugs in the first place. And since the pills have been shut off, it's gotten even worse. They'll do anything and everything that comes down the pike.
Mr. Pelletier.
I had a friend,
Just gonna remind you, there's a 3 minute.
3 minutes, yes, ma'am.
Thank you.
I had a friend. Him and his girl had a son, and they broke up. He went on to have another girlfriend, and the mother came to live with the girlfriend. So the three of them, his new girlfriend's 2 kids, and him and his ex-girlfriend and their kid. When the pills got shut off, everybody went on to heroin. And it went from somewhat nasty to totally dark and grim, gruesome for everybody. They all become decrepit. This guy went to jail for home invasion and got clean. While he was in jail, the kid's mother died, the first girlfriend. While the second girlfriend was watching with her kids and his, he gets out 3 years later and told his girlfriend, "Oh, I'm done drugs and clean and everything else." And his second day out on Father's Day, he dropped dead from a hit of whatever it was, fentanyl probably. So now this kid is left alone. Both his parents are OD, died and gone, and he is angry at the world. Okay. These resources to the methadone clinics and stuff are not helping. People are actually believing that the more drugs they do, the cooler they are. And the younger people are idolizing them.
Mr. Pelletier, you've gone for 6 minutes. Can you?
Yes, ma'am.
wrap it up,
Thank
please?
you for listening.
Thank you very much. Questions for Mr. Pelletier?
Well, sure, I'll ask. I hear what you're saying. I hear your frustration, right?
I don't think you do.
Well, I'm hearing it.
I'm
You-
trying
I mean,
to portray,
Well-
yes, sir, but
No, it's okay. Well, it's fine. I don't mean to be patronizing. I hear the passion of
sure,
what
sure,
you just,
okay.
what you presented here, and so help me as a member of the council. What do we need to do better? I mean, what's going to help the situation you're talking about?
Okay.
Which isn't unique to, it may be more, the
Okay,
area that
I
you're
have
in.
an
right?
answer. I have an answer
Good.
for that.
Yeah.
It was maybe 2 years ago. Census took on the Maine education system, and scores come lowest in the nation. And as far as I can remember, Maine's education scores hasn't been far from the bottom for a long, long time, making the state of Maine the dumbest in the nation. How about some education, making them get A's and B's, giving them something to look forward to and aspire to, other than what drug they're going to do next. I see our leaders just as dumb. How does one person, like our Secretary of State, just decide she's going to make a congressional decision all by herself by taking the President Trump off the ballot?
Right.
Okay, we got all, and people agreeing. My governor, Governor Mills, I voted for, tells me that I'm weird because I voted for Trump. This whole thing is weird.
Thank
Any more questions?
Thank you.
Thank you.
Thank
Have a
you.
good day.
Drive safe, be careful. So is there there's no other names left up there. So here's where we are. We promised to be here till 1. But I don't know if everybody needs to be here till 1 if there's no one here. But we do have a couple items, business items, I just want to review quickly. And then people can choose. I will stay till 1. People can make the determination if they're not, but we did promise to be here till 1. But for those who need to leave, we can do that.
My personal thought is,
Hmm?
my personal thought is we advertise till 1, everybody should stay
Yeah.
till at least 1.
Yeah. So, okay, so no one's here, so I'll tell you what, why don't we at this point, why don't we take a little break? And reconvene in 10 minutes. And then we can do a couple business items that I had. And then we'll be able to still be here and honor people that we said would be here at 1. So we'll take a 10-minute break. Gordon, we're taking a 10-minute break.
I hear you. I'll take my 10-minute break too. Thanks.
So we're going to have.
It is, yeah.
Evidence-based stigma. I think that's why.
Boy, you and I are old.
We are, thank God.
Yeah.
I don't want to be young anymore. Who are we missing here? Gordon, are you back?
Yes, and I'll come on camera. I don't know who can see me and who can't, but.
All right, so Gordon, because you don't know that, we don't have any audience here left. We probably have people still listening in. But nobody is here. Everyone who signed up to testify has had an opportunity to testify. And we're just sort of waiting here until 1, because that's what we promised and we like to live by our promises. So we will be here. So in the meantime, we can conduct a little bit of business that are here. I have 2 items I want to talk about, and then council members certainly can do that. One is, I want to make sure that we understand that I believe Joe and Tess and Gordon, Betsy signed up for governance. Did I miss somebody? Okay, that's 5 of us. Okay. Signed up for the governance committee that will discuss and take in nominations for the executive committee positions. And we will meet via Zoom before the next meeting. And then once they have that slate, they will pass it on to the memberships and then have a full vote in January. So everyone is agreed on that process.
Who were the new people that joined that weren't on it last?
Joe was not on it last time. Tess wasn't. Betsy, Gordon, and I were.
Courtney was, right?
And Courtney was, and was Eric?
Yes.
Yeah.
And Eric. So those were on it before. And again, that can change come January because the chair, then after the new chair gets elected, that chair appoints people to committees.
Okay, so the governance committee is gonna take nominations for the executive committee?
Yeah, for the chair, the vice chair, the treasurer, all of those have to be,
Which is essentially the officers.
yeah, the officers for the, correct. And those officers have to be voted in at the annual meeting, and according to your bylaws, the annual meeting is in January. So that's what the rush is to push that through.
Is that gonna be the second Thursday?
That'll be the second Thursday, barring snowstorms in January.
So Pat, does that mean that the governance committee then will meet in advance of the January 9th meeting, you mean?
That's correct. Yeah.
Yeah, sure. That's my
And
understanding.
I'll send out an email to everybody with a couple possible dates.
Mhm.
And then we'll go from there.
Okay, and as you know, I'd like to talk about the potential meeting of the executive committee when
Correct.
that comes up in the next 19 minutes.
Okay, well, if there's no other discussion in regard to governance, then Gordon, you and I, were going to talk about the same thing, so I'm going to give you the floor.
But can I just clarify, Pat? So January the 9th is the meeting.
Yes.
Right.
That's a regular meeting of the
Regular,
council.
yeah.
Will that be the afternoon like we've been?
Yeah, it'll be the normal, it'll be, I hope, Grayson, we're back in our space, right? So in the same space, it
1:30?
1:30, 4:30.
1:30 to 4:30.
Okay.
Yeah. Yeah, it has to be 2 weeks out. That's why tomorrow, what's today, Thursday, I will send an email to everybody and I just need dates and then we'll book it.
Tomorrow is the 13th.
Friday the 13th.
Yeah.
So 13 and 14 is 27.
Yep.
So maybe the next week. So Friday, the 27th would be the soonest.
And no one's gonna meet then, it'll probably be more likely the week of the 30th in there.
Okay.
But we will send out dates to people and that will be a Zoom meeting.
So that'll probably be December 30 or 31.
Yeah.
It will have to be after the first, because I want to.
It'll have to be after the 1st?
Yeah.
Okay.
So not December 30.
Okay, I will send out possible dates to everybody, I promise by tomorrow. All right. Okay,
Do you want to move on here?
all right. Come join us, Mary. All right, so the next subject we're going to talk a little bit about is about contracts and about the executive committee, a possible executive committee meeting. And Gordon, do you want to talk about that?
Yes, yes, I'd like to. And you can hear me okay?
We can.
So I realize we've got the members of the council plus Mary. We don't have Brendan with us, right?
No, he had to go back to the office.
And then we've got whoever may be observing publicly. It looks like there's 15 participants in this Zoom. So it's a public meeting. I want to be diplomatic in how I say what I'm about to say. I've been assisting Mary with some of the contracts, particularly we're working on the milestone contract, which can be then later used immediately for the contract for Tessa's house. As you know, you have voted $1.1 million for each of those projects, and those are the priority to get those contracts done. But in the process of doing that, it has become clear to me that the way that we're going about these contracts now is simply not working. And particularly, it's now become acute because we have those 43 projects in front of us. And yet we've not completed the contracts. At least we have 7 or 8 in my count that we voted last December, a year ago. I'm not intending to put this onto any individual. It's just that the way that we've gone about this, everybody's done the best they could under the circumstances, but it's quite clear that if we don't change the process of how we're doing these contracts and getting the money out the door, then we'll have really disappointed the 43 applicants because it would literally be taking, you're not talking weeks or months, you're talking years. So I would like to pick up the pace. I think actually that Dr. Vinsel said something earlier today that kind of was consistent with that this is a new council now. The previous council did everything they possibly could. And I'm really proud of the work of those 2 years. But now we need to absolutely pick up the pace. And we can't do that without additional resources. So to even fast track that, I'd like to ask that the executive committee, if the executive committee could meet sometime before the January 9th meeting, to do a number of things, but particularly to prioritize, to start a process of prioritizing those 43 contracts, to know an idea of okay, which ones do we start with first? Also to look at the contracts that have not been completed from 12 months ago, see how those might be prioritized, and just be ready on January 9th to say, okay, this is the work in front of us, and also talk about how we get more resources to prepare the contracts. Getting the money out the door after the contracts are signed is also an issue, but I think first, one thing at a time. So my simple request right now is simply, there aren't, with the holidays, I know it's not going to be easy for people, and that meeting does have to be publicly noticed, but there would be an opportunity, I'm hoping, the week of the 30th or even the week of the 6th. We could meet Monday or Tuesday or Wednesday before the Thursday meeting, because we really need to accelerate. Thank you.
About, for some reason, I was under the impression that Barry Dunn was gonna help us with contracting, writing the contracts for the. Okay, so is it false then to assume that it will be faster? I mean, I guess I was thinking that because we hired Barry Dunn to help us with the contract, that it will be faster this time. Yes.
Okay, and now that we have an interim chair, their contract could be signed officially. But we met yesterday and they're already starting to help us with developing templates for the grant. Yeah.
So in sort of Liz, in that venue though, it's our decision as a council to prioritize those.
Oh, I see.
So-
I see.
So it's so that, yes, that they're going to help us with the work, but they don't know if we look at what we've allocated, do we have priorities that are, how does that roll out? Because they wouldn't know what those are.
If Barry Dunn is helping us with the contracts, if we give Barry Dunn more money, do the contracts get done quicker?
Good
Do
question.
they have more people
Yeah.
available, that the more money we give them, the more people they put on our project and get it done?
Can I jump in and say, theoretically, yes, that could help. But right now we need to figure out what the contracting process looks like, because it's very much, I mean, we have a role to play, but the recovery fund sits within the AG's bank account. So we still have to follow certain state processes. And so Barry Dunn's on board to help us actually draft and develop and execute on the contracts, but they need to know what the process is for us to move through. And so I think even if we had all the contracts ready and developed tomorrow, we would still need to have conversations with the AG's office about how that can actually get done, because their staff is really involved. I think more involved than I recognize, which has been a challenge, but we've had conversations the past 2 weeks. And I think we're getting closer to having an understanding of the process. So the council knows, you know, what type of staffing support would actually be most useful. And if it's having, you know, Barry Dunn contracted for Laura, great. But if we need additional support, you know, for something else, or if it's a legal consultation, or if it's somebody who understands, you know, the AG's system better, you know, just kind of throwing things out there, but yeah, that's been a challenge. And again, we're looking at it from both sides, and I think we're getting close.
It needs to be a collaboration between Barry Dunn, the AG's office.
Yes, but more so between myself and the AG's office, so I can direct Barry Dunn about how to do the contracting.
Kind of middleman in
Right.
between.
And what boxes we need to check, what that contract template can even look like, to make sure it passes, again, all the checks they need to look at. Because I feel like we've been at the 90-yard line, and then all the information I have tells me, oh, we're ready. And then we learn about additional steps because we're all going through this for the first time in many ways. And unlike DHHS, for instance, the AG's office doesn't have the contracting infrastructure to do this.
Yeah, so if I'm not mistaken, what you're saying is that we need a clarification from the AG's office that we're trying to get a meeting with. Because even if we write the contract, they have to review them and they have to process them.
Yes.
And so we want to make sure we know what's needed to do so it doesn't get a roadblock there. Like, we could have the fastest process ever, but unless we understand what their process is, we're trying to connect the two to have a clear, straight path.
Exactly. And their process does influence our time, which makes it, again, complicated.
And we want to know if we can uncomplicate it. That's one of the
Yeah,
things that
and
we
that's the
will
goal.
talk about is how are we going to uncomplicate this? Because, you know, do we have to do something different in order to get out of this? To be able to get our money where it needs to go? I mean, we're just even talking contracts. We're not even talking at this point about writing getting the reimbursement checks actually out. But that's a whole other ballgame. So I think we have to understand exactly what is the minimal thing they need to do to get our contracts where they need to go.
Pat,
Yep, Gordon?
you did mention in passing that we have asked for a meeting that is being worked on, is being set up that I believe would include Brendan and the Attorney General himself, myself, maybe Summer, who's their new financial person, maybe Pat, maybe Mary, to answer that specific question, which really only the Attorney General can answer, is how much involvement do they want? We've had the 2-year experience. How much do they want to be involved in these contracts? Can they draft them? Do they need to review them? And really that has to start with Attorney General Fry. Now, in deference to him, until last Monday, we didn't know, he didn't know whether he would be the Attorney General. So, we're pacing this as fast as we can, but I'm really pressing them to have this meeting over the holidays. That meeting does not have to be publicly noticed. And so we need to get that done. But it is really going to be difficult getting into January if we haven't gotten that signal from them. How many steps does this take? Mary has said it very well, and I'm only recently become aware of just how acute this situation is, that Mary's essentially drafting these contracts, and I'm trying to help her as best I can. That was never in her job description, and it's not fair. It's not fair to her, because if she's doing that, she can't do the other work of the council. I was very alarmed. She's very, very bright. She can do this, but that's not
Thanks, Jordan.
the plan.
She
That's
doesn't
not
want to
in
do
the,
it, Gordon.
that is not in, that was not what we thought was the plan.
So Gordon, I may have missed it. What was your ask of the group and meeting the first week of January?
Yeah, I'd like to have the executive committee be ready to recommend to the council on the 9th what the prioritization of our immediate work should be. Now, we have, I think, 8 or 9 contracts that we're already working on that have not been finished, have not been signed. Money is not out the door. And that includes Milestone, Tessa's House, at least one or more of the SSP contracts. We haven't done the Peter Alfond contract. Mayan, Joe, you might know, if we haven't done the Peter Alfond contract, we probably haven't done the Mayan contract. So again, we've got the existing, that would have been, that's going to be quite a piece of work to get that all wrapped up. But at the same time, we absolutely need to start thinking about what the timeline is for these 43 new contracts, how we get them done, and what do we prioritize. For instance, I've been thinking, well, maybe we should do the bigger, upon what basis do we prioritize these 43 projects? We have, for instance, $1 million for Wabanaki. That's the largest contract. Well, would it make some sense to get that one out the door? In other words, don't start with a $50,000 contract and leave that $1 million in the bank where we might not be able to get it out the door for a year. So again, I just think that if we have this discussion all over again on January 9th, we will have lost an opportunity. I'll be honest with you, I also believe, Joe, that we might need to even increase our meetings. As we get, one meeting a month, unless we're going to really start using the subcommittees more, I don't think it's fast enough. I don't think it's enough. And I don't think we'll be able to accelerate the pace. We need to do 2 things. We need to have more meetings, but I also think clearly the priority would be we need to have more staff. And then hopefully within a few months, we'll have a good timeline. The contracts will be getting done, money will be getting out the door. We can do this. We can do hard things.
I just want to say thank you, Gordon. It's a year today that we appropriated 9 million. Was it 9 million? So I really feel like all eyes are on us, and I'm not even sure what. And I know Mary, again, you're one person doing 17, but I think it's been a year, So that's like, to me, a priority to get. And I agree, everything you said, Gordon, I'm in agreement. More meetings, whatever we have to do to help move this along. Because I do think we'll get traction in the next few months with our rhythm and process with the AG's office, and like we're there. It's just now like getting resources, Barry Dunn, other people, but maybe, and this is a bit tangential, but the AG sounds like they may need. So I don't know how that plays into it, but like Brendan's one person and he has other jobs, and these guys have other jobs. So
And I have job descriptions for the support roles I think we need written up and ready, and those were with the last council. So if it's the will of the group and it's allowed, I'll bring those to the executive committee and we can hopefully recommend moving forward with this.
I'll give up my seat if you guys all want to put me on the table. I'll help Mary. And I'm not even joking.
That is tempting. Again, we do need to, again, and it's not that the executive committee is making a huge decision. We just want to be able to set a draft up. So the council, the full council gets to look at it, and then it's easier if you start with a draft and then adjust it from there, rather than come with just an open slate saying we're going to start. So if the executive committee, with the approval of the board, can have this discussion, again, and it's open, so that means you welcome to join, any council member can join us. And it's on the Zoom, so it's there. We just want to be able to do some sort of draft to present to the January meeting to push this forward.
I guess I have a question of who's the executive.
So the executive committee is the chair, the vice chair, the treasurer, the secretary, and we have.
But in that meantime, we don't have one yet, so who?
We vote, oh, I'm sorry, we voted on it. We voted on a temporary.
It's the same ones that were before.
We voted on a temporary one until the ones in January. Sorry, Chelsea, you weren't there. So yeah, so we just did it, the placeholder, to be able to do it for January.
Do you need a motion?
I don't think we need a motion. I think we just needed to be able to, again, in transparency, to say what we were doing, and you will all get a notice of the meeting because it's a public meeting, and you're all welcome. We just wanted, again, we're just, I mean, today you saw that. You saw people here very grateful they got money. They may not be so grateful in a year and a half if they still haven't got their money. They may have a whole other thing to say. We may get a little anger towards that. So again, we're just trying to jumpstart that. I mean, and Paul and I had a conversation. I mean, the finance committee has to get up and running, because one of the things that we have to look at is, do we have extra money? Did we give away not enough? Did we in the grant, is there funding left for programs that we reviewed grants that we want to support? And so we need to get that finance committee up and running to really, for Ben and the crew to really look at that and say, yep, you got $1 million left, or you have, this left. So then at that point we're not going to ask people to reapply. We may ask questions, but we're going to take the existing grants that we've already scored and try to move forward to some programs we think could have impact.
And the executive committee also look at what Gordon's suggestion of increase the number of meetings of the council. As we're sitting here talking, I have members of the public texting me that we're not going fast enough.
Yeah, we can have that certainly in the January meeting as part of the agenda, to look at increasing our calendar and increasing our meeting time. We can certainly put that on the agenda and have an open discussion about that, and be able to set some dates, what works for people.
And again, to be tangential, being who I am, I do think we learned a lot this morning, hearing from people. I think there's just sort of like pockets of things that the council needs to talk about and opine about, sort of just, how we feel of organizations that are struggling financially, and what's our responsibility to those groups, and some of the various themes this morning. So I think, we might want to just, well, you guys can figure out kind of ways to set up a couple of more meetings. I'm in agreement with that, because I think we got contracts to do, but we have a lot of we heard a lot of important information this morning.
Yeah.
This is a semi-related question. The consultant that we hired, where do they fit into all of this and what we're doing? And
Are you done?
no,
Sarah Yasner?
Yes.
Yeah, so she was hired as an executive coach with a focus on helping Mary to present and set priorities. We did not hire her. Remember, you took out of that strategic planning and long-range planning, you took that out of the contract. So most of her job is helping Mary evaluate the grant process, look at how we approve. Mary, please chime in, talking to board members about how to improve meeting structure, those kinds of things. But that's for Sarah, and that's a short-ended contract that only goes, I think, till June.
So when and where is that fitting though, I guess, then?
She fits in more with Mary, not necessarily with this. I mean, again,
Like,
in
are
her,
we all gonna be meeting with her? What's the timeline of that? And with Mary juggling all these other pieces? Like, are we just adding to Mary's list?
no, she's Mary's support.
Okay.
She's helping Mary with executive coaching, which means helping Mary set her priorities, looking at work, presentation. Am I right with that?
And a large part of it is around, you know, soliciting your feedback about the grant process and mine. I'm trying to have a neutral person come in and help facilitate that before time gets away.
Do we know when roughly that's gonna be, like January or not till May, because we have 1,000 priorities?
Yeah. Well, I mean, the contract is ready and drafted. I just need the signatures on it for her to start. I would love I think we can do the grant review in conjunction with other priority items, but I think we would miss out on a really important opportunity if we didn't talk about ways to improve the grant. And if we talk about strategic planning and what types of funding opportunities we want in the future, we need to know what to improve on from what we've done so far. So. But Barry Dunn will be more actively involved.
But Barry Dunn is the real contract. That's the real help with the contract. All right. Any other discussion? You've been sitting here for a long time. Oh, Liz, sorry.
I'm so sorry. I do have something that I just want to bring to the council, and you all can tell me, guide me or others. I know there's a desire to move the prevention work forward. So I want to, I have sort of 3 pieces that I wanted to bring up to you all to think about, and then we can either discuss them and decide that you want to bring some of these things forward at the January meeting, or moving forward maybe at a program and grants meeting or at a future council meeting. One was about John T. Gorman, and they are they are willing to come to talk to us about their process that they have done with funding to gen approaches, and they would be willing to come at a future meeting, not the January one, but they could come to ones after that. So that's one thing that I'd love for you to think about. For the goal 3, that was about the 18 to 25-year-old population and doing more work around prevention in that group. The recommendation of the council was, or of the work group, was that you consider funding the Maine Prevention Network, because that was part of it, is the Maine Prevention Network does prevention work, and that they have a previous history of doing 18 to 25-year-old work. They just haven't had the capacity to do it, and then they would fund local coalitions to do that work as well. I think if we don't have to decide that now, but the thing we do have to know about is, are we able to transfer money from this council to a state agency? And I know that was an issue in the past, and I think that has to be legislatively dealt with, right? So I just want.
No, I think Ben fixed it.
Done. It was done. Is Ben with us?
No, he's gone.
Okay, I can tell you that but it was limited, the legislative fix was in the budget, but it was only limited to HHS.
Great, well, that's within HHS.
As I recall, but this is within HHS. So I believe that the answer to your question is yes.
Perfect, great. So we can move on from that one. And then the last one is, you know, in goal 1, which is around community coalitions, addressing community conditions within communities that have been really highly impacted by opioids. That goal, one of the recommendation was around, there was a recommendation around providing technical assistance. And I think
in thinking about both goal 1 and 2, how we go about doing the RFP process, how we go about soliciting organizations to do that, I think there are some lessons we could learn from other organizations who've done this work. So in the spirit of full transparency, I think we should, perhaps the group should think about, like, are there TA providers we want to solicit for that? I have one we've worked with that does this work across the country, who is willing to come. It's Health Resources in Action. They do this work specifically around community coalitions and community engagement and they'd be willing to come and share their experience of providing TA. We do not have to hire them. We do not, but it's a way for us, for those of you who may be unfamiliar with what that might look like, to get information from them about how an organization even does that, what that could look like. I think it's slightly complicated. Do we want to just put out a call for an RFP to anyone? Do we want to have a TA provider that actually could help these community-based coalitions come up with a really great project that we think can have the most impact in that community? So you can hire a TA provider to help organizations who want to do the work to even like figure out how to make a project and write a great RFP. And then you choose from an RFPs that you know have had like support to do that work. So we may not want to fund that and just do it differently, but I guess I just wanted to provide us with some options for then how to move this work forward. So Health Resources in Action would be willing to come in the future as well to a meeting.
Do you think, Liz, that you think it would be beneficial that we have a meeting sometime in February that would be specific to the prevention, and at that meeting invite the Gorham Foundation and this technical assistant group to present to the board and sort of have a focus of a meeting, say in February? Does that?
So we could certainly do that. That would be, if the council thinks that would be, I mean, because it sounds like we have a lot on our table for January, right, but maybe in February if we want to.
And I'm wondering, I'm thinking it belongs with the full council, but it could also belong with grants and programming. I don't know, but I'm thinking if it's talking about process and grant, that it really needs to come to the full council, not the grants.
I feel like it could be really beneficial for the whole council.
That's
so everybody feels like you feel good about and having decision-making about what kind of process you want to see, given the process we had in the past. What do you want to see in the future? I mean, I think there are many things that can go to program and grants in the future. This one feels like it could be really good for the full council.
I'm thinking, and again, please correct me if I've overspoken, but I think what we can do is if we agree in January to meet more often, we can actually make a whole meeting in regards to prevention that will dedicate a whole meeting to, other than a few little pieces of business, but dedicated to educating ourselves as to how we want this process to look to get prevention dollars out the door. Because again, it's a twofold. We want the money we've already allocated out,
right,
and we want those contracts, but we don't want to say, oh, well, prevention, we're going to put you on a back burner. We don't want that. We want to keep that going. So does that seem reasonable if we do that? In January, we decide to do that, to have more meetings. One of the meetings in February will be dedicated to prevention, and we'll get back to when we know dates, and maybe you can arrange for the people to come to be able to give us some education to make some decisions.
So Liz, I love the idea of TA, and I think that what I'd like to see is sort of like that as a concept.
Yeah.
Like that, if in my original thought, but if you think of us like a foundation, like we have a lot of money over the next 20 years, like I think we need to sort of deliberate that.
Yeah.
So like you have a group that can come and speak to us, but I think that's sort of like a concept. What are our thoughts around that? And I personally think we should be funding things like that. You heard that this morning, like the various sizing agencies have needs. So I think that might not go exactly with what you're thinking with John D. Corman, JTG coming to talk about 2G, but if it does fit together, because also John T. Gorman could probably give us some pointers on what they do around TA and how they hire people. So I think there's value to that. John T. Gorman coming talk about their 2G work, but also what they fund as a foundation.
Well, and I think that was part of the conversation that I had with them was like, and would, what is the TA you provide now and what does that look like? And so I think they could give us some of their experience of what they've seen and the impact that can have on projects and on organizations, really providing that TA to them.
All right. Okay, so we have a plan. We're gonna meet governance, executive committee's gonna meet. Gonna talk about the January agenda and get that moving. I think we have a plan in place to move forward.
Yep.
I appreciate all of your time here, particularly after the wild last night that we had in regard to wind and rain and everything else. I wish you all nice holidays. And stay safe. Stay safe. Thank
Thanks,
you.
everyone.
Meeting adjourned. Gordon, thank you.
Thank you. Bye-bye. Happy holidays.
No.